My bad, guys. I thought I already hit the live button. My bad. I realized I didn't hit the live button until now. Sorry about that. I'm gonna restart the song to showcase it to people. This was done by subscriber Evil Eddie. He's been making me a new song each week. One of the new ones. We'll be talking about healthcare, kind of talking about health insurance as well.
Head full of noise, everybody preaching, but nobody builds boys. Cold screen profits selling weakness by design. No,
what's up, Keyshawn Jones? Thanks for showing up, man.
To show me how to climb.
Letting the song play and some people come in and stuff. And then we'll talk about healthcare.
Brothers in the fire, teaching damaged souls. We don't need another lecture. We need mentors. Heavyweights and hard truths, and real damn brothers. Barbells in the basement, steel inside the chest. Men survive together, that's when we're at our best.
This is the healthcare one. Use this time to get, quote unquote, medicated.
Old scars on
I
old
think that's what I'm about
hands.
to do. Take some
Stories in the smoke.
medicine.
Lessons in the gym light between every joke. Late night garage talks, engines growling low. Strong men build strong men. That's how the good blood grows. No savior coming, no easy cure. Find a crew beside you and suffer to endure. Lift heavy, fight harder, stand your ground again. The road back to meaning starts with better men. Starts with better men.
Again, another banger from Evil Eddie. Go support him. He's really awesome. We got a new song coming out you each week like this. That was last week's one. So let's get on to the topic here. I want to talk about the healthcare system, basically, and excuse me, how it's very intertwined with insurance companies, big food, big sugar, FDA, Department of Agriculture, um, the Surgeon General, things like this. They're all intertwined. So you are basically patient zero. And by patient zero, we mean that they give zero shits about you. For one, we know a lot of the food is poison, has a bunch of chemicals and stuff in it. And guess what? Do you think a healthcare company or anything cares about that? No, because they get money off of it. Doctors aren't really doing much about it. RFK hasn't done anything about it. So who's going to do anything about it? Nobody. Why? Because these companies are profiting off of it and using you as like kind of a lab rat on like a hamster wheel. That's all related to healthcare. Because these companies, someone's going to say, "Well, I'm a health insurance company. I'm not. I don't have anything to do with food." Yeah, kind of. That's true. But it's also you also look the other way as well. So this is kind of like what kosher foods are and things like that. It's just basically a food that's like not corrupted. Why do you think there's kosher food or halal food and whatnot, and just other food which is considered slop? So the the standards that we have are really bad. So I want to take like a recent example to me that happened to me. I cut my finger recently doing something, splitting wood. Excuse me. I have allergies, so I'm going to be kind of clearing my throat a little bit more through this. So I cut my finger splitting some wood, and it was actually bleeding pretty bad. So we didn't. It wasn't really like we needed to call 911. Excuse me. So we went to my urgent care. So I went in, and they make it as like difficult as possible to be seen. I had to wait a really long time, and I had a pretty decent cut going. I had wrapped it up and had a rag over it and did everything as best I could. So you come in and you sign into a computer first. First thing you do is you sign into a computer. The lady at the front desk says, "No, no, no, I can't help you. You need to sign in there first." So you go and sign in. Then she asks for your information again: first name, last name, address, and that, which you just filled out in the computer. She said, "Sir, that will be $160." So I handed her the money, and almost a little bit of blood almost went on the money. She did not care whatsoever at all. And cash, by the way, cash, not the card, cash. So then I proceed, and no one else is in the office. There's no one in front of us. There was no one else in the parking lot. So I go in, and now I'm just sitting there, trying to, not panic and keep your blood pressure down and whatnot, and just say like, okay, I feel a little bit better now that I'm here, and now that they're aware of it. I had to wait sitting there bleeding for like an hour, over an hour. They just did not give a shit at all. Did not give a shit. Then you go into the waiting room and they still don't give a shit. You just wait hours. I had to wait like 4 hours for them to do about 30 minutes of work, including cleaning it out and letting it soak. But the actual time to do the stitches and all that it didn't take long at all. It should have been pretty much a simple thing. Put some of that numbing agent on it, throw some stitches on there, wrap it up. You're good to go. That took so long. So my other friend that brought me and the guy that works for me, he's from Russia. And he was like, "This is embarrassing." They were like ready to let you bleed out before anyone even gave a shit. And like, I don't know why they call it urgent care. He's literally saying, "Why do they call it urgent care?" He's like, "That's the last thing they should call it." And no one gave a shit. Like, it actually felt like a real, almost like a humiliation ritual or something. And I didn't want to get mad and cause some type of scene or something, because then they'd say, "Okay, now you need to be kicked out." Because I like passed out in the waiting room. So, kind kind of like twice I passed out. Not in the not in the lobby, like in the waiting room. Because I was like, can you guys just hurry this up and just, get this going? Like I would see how I'm bleeding here. Can we just like try to stop some of this? Then I could even pay for the shit like after that and everything. But can we get this going first? This is the whole point of urgent care, is they would help you do something like this. So it's just very frustrating. So I ended up having to take, and the good thing is, I will give them this. It was only like $160. That was pretty good. Even though it wasn't, it shouldn't have taken that long how to do anything. So, I just decided today I'm gonna just remove the stitches on my own, and it was actually pretty easy to do. I'm not gonna go back there and deal with so another thing too, my friend noticed when he was in there that when I was in there being worked on for like 3 hours seemed like for like a long time to do like 10 minutes of work, probably even way less than that. So he noticed that a few people came and then left. And they said like, well, we made an appointment for this time, and they just waited. I could not believe how they only had one doctor there, and none of the nurses or anyone gave a shit at all. At all. Almost like they were a complete just robot. It was really kind of profound experience. But this is just your local urgent care guys. This is probably what most of them are like. Incompetent, lazy, don't care when you're bleeding. They like didn't care at all. And I'm not, I'm not someone who's like the best with blood and stuff like that, but I'm not like a pussy. I wasn't like making a big deal out of it. It didn't really hurt that bad, but like, I was like, can we just, if you saw someone get hurt, you would try to help them stop the bleeding first, even if they were, it's just the fact that I even have to explain any of this to anybody is the problem. So that does not summarize all of healthcare in America by any means. Not at all. That's for someone who just had something cheap. They didn't want to go to the hospital and get a bigger hospital bill and stuff like that. And it was a thing I actually had to go for. I tried to kind of like take care of it on my own, of course, and that really wasn't working. So this is a thing like I did have to go in for, because there are a lot of other people who go in for things that they maybe shouldn't have to go in for. So I can see how that can clog up the system, but this case it wasn't clogged at all. So that has kind of shown me the lack of care between people. They just didn't really care. And that will echo through everything. And it really shows, like, even if this was like a mechanic shop or something else, like you just doing anything, a subway, you figured they would like kind of like care. They seem to care like a little bit. People just don't care sometimes. And it's like really unbelievable, really unbelievable. So this is another one from More Perfect Union. These guys do a really good job. Some of the people are kind of a little bit snobby, douchey liberals who like are the speakers and announcers, but they do a great job with the cinematography and stuff like that, in my opinion. I think they do a good job. And I shouldn't say they look, all goofy. They're actually probably killing it.
This is the future of healthcare. Oh, I'm sorry. This is the future of healthcare. If I was confused, it's because, according to the former CEO, they have the same business model.
Well, when it's urgent care, it definitely feels like that. Look who's in front of the building, too. 666, right in front of this demon kidney care place. See this plate, 666?
If I had 1,400 Taco Bells and 32,000 people who work.
And again, this level, the standard of how they do things is not far above a Taco Bell, guys. I'm telling you. Like, this is a problem. If America is a company, a country, and a company, we are dog shit. What, we don't care about anything. We don't know how to sell anything. We don't know how to do service anymore, any service related jobs. We're trash at it. People are just an empty husk walking around that they just don't give a shit about any of this. We are accepting completely low standards here.
Worked in them.
And we don't have to. We have enough money to help everybody and stuff.
Would be doing all the same stuff.
You may not have heard of DaVita, but they're everywhere, along with their biggest competitor, Fresenius. They're the biggest player
right across the street
in the dialysis market, which...
And so another thing is too, they love, it's funny because my Russian friend even said this, they love a dialysis patient because they get to make a ton of money off them. When it's someone like me where they had to do actually some work, and I only paid them like $160, they hated me and bitched about it. So it's pretty crazy. Nice. ESARS is going to have to go to the urgent care after hitting that.
You may not know or particularly care about, but you should, because more than likely, you have a kidney inside of you right now. And nearly 750,000 people a year experience kidney failure, while over 500,000 Americans are currently receiving the only treatment for kidney failure besides a transplant, dialysis. But taking a look at how the free market ran wild on just this one organ, the human body, can give us some insight into the future of American healthcare.
They're doing a lot of things that you might encourage a fast food restaurant to do, like get a lot of patients to the facility.
Yeah, treating you like it's the perfect analogy. That's exactly what you think we would be like.
Each day.
Don't do quality, just care about numbers and product. Keep the shareholders happy.
Cut back on wages, cut back on costs. Turns out the kidneys are a little different than a Crunchwrap Supreme.
I was scared because at that point was when I realized I can die on the chair and I won't even know it.
This is Carmen.
Holy crap.
Because Carmen's kidneys didn't work properly, she needed to show up to dialysis several times a week just to stay alive. For over a decade,
that's crazy.
Carmen showed up week after week so a machine could do what her kidneys couldn't, clean her blood. And for most of that time, the clinic performing that life-saving service was a DaVita. Over time, Carmen had witnessed the kind of cost-cutting and decline in quality many of us have witnessed in retail, food, and furniture.
In 14.
Yeah, because you're not aware. You can just have slop. You can just have slop. Yeah, I don't like watching the blood stuff, guys, to be honest with you. I'm going to fast forward a little bit to 304 here.
Workers and kidney doctors to blow the lid
I haven't seen this before.
On this industry. It is, and I'm not exaggerating, the most horrifying thing I've read in years. And I asked him, what happens when you do this kind of high-speed dialysis with not enough staff?
I've talked with Magellan Hanford, who's a former LAPD officer who retrained as a dialysis nurse. He said that at times, as a nurse, he had 17 patients that he was responsible for.
Exactly, and that's like the situation that I was put in. You know, I wasn't doing that, but it's crazy, and it doesn't have to be that way. And these people are not getting paid enough too. So the people at the bottom of the pyramid are not being paid enough. You know, it's not fun for them to be there. They're not prospering. They're just kind of a wage slave. It's going to affect the healthcare system. And what they're trying to do, or maybe one way of looking at it, is boomers come in and bitch about healthcare big time. They know how to bitch about healthcare. They're used to having decent healthcare, personal relationship with the doctor, not a bunch of automated stuff. Things of this nature. A lot of them are hypochondriacs too, so they go in. a lot, and they're getting at the age more, and they have some money to spend, so they'll spend it. And make no mistake about it, they'll spend it trying to like stay on some weird ventilator for another like 4 months, um, and that will be like money that maybe could have went to you or something like that. But to each their own. This is not really about boomers and stuff, but I'm saying the level of care that they would, the care and service and stuff, they would actually complain about it more. Millennials, well, maybe some millennials, but like Gen Z and stuff like that, we're just kind of used to like, well, okay, we don't even like have healthcare, and like it kind of sucks if we do, and we're just there to overprescribe stuff, and you know what I mean? Like, this is the problem. Are we healthy as a nation and people? Because they're all linked together.
And his description of a day at the office was like working in a MASH unit in a war zone. It was, someone's cramping here, someone's coding here, running from place to place. More than once, he described having to put a deceased patient under a sheet and continue treating everyone else because there was just no other option.
You're just sitting there waiting to see what emergency is going to happen.
Yep, at an urgent care, a place. Don't you think it'd be good to have a couple people, like more than one doctor at one of these facilities? They want to profit off of you. That's the only new building they build. The only buildings they build in the United States now are garden-style apartments, or the only businesses that they're going to have is what? Vape shop, urgent care, abortion clinic, and garden-style apartments in like Chipotle. That's what we're getting here. That's your average strip mall in America now. Is that what you want? And by the way, the people are incompetent. They're not incompetent. They're not happy. Gas is expensive for them too. Sometimes, they're driving from 2 towns away and stuff like that. So I get it that they don't want to be there and they're not prospering and shit like that. Like, I understand it, but when someone's hurt or something, you got to like just basically put that aside and help them. You know what I mean? Like, people need to take some pride in their work. We don't have really a lot of pride in our work that much anymore. That's why some of you guys need to go out and start some of your own business and work for yourself. Get in the game working for yourself. You'll start to see that it's so much different than when you have to go back to work for somebody else. It's just a whole different thing. And a lot of people that are working for like huge companies and corporations, you forget to see like the service part and the personalized part is really important. And a lot of these places are just missing that, so they just make money off your back and just keep kicking it up. It's to the point where they're making the process so like that they're like, well, just leave the patient in there by himself, make him wait, make him scared, make him like start worrying about stuff. And you can hear them just talking outside the door, just hanging out, probably playing like Angry Birds or some retarded bullshit like this. That's what they're doing in there. That's it.
I've bled out. And while I'm bleeding out, there's a person across from me that is alarming. Who are they going to help first?
And it's not just DeVita. For the story, I spoke to Fresenius workers across
But
California.
notice how they put that guy, like how insurance has made it so they can just have one person there. So insurance has made it so you can have one person there responsible for like 17 things. But insurance has made it so you have to pay a bunch of money, or insurance has made it so you can't build a shed in your backyard or something like that without all the proper equipment, and you need to have the proper exhaust on your car and stuff. But that same insurance company will be like making it so one person is in charge of all these people and stuff. It's stupid. And it's like it's an inversion. It's an illusion of health care, caring about your health and stuff like that. It's so ridiculous. Keyshawn Jones writes in, "Hey, snowboard." do you think our healthcare system will ever get better in 10 or 20 or 40 years from now? Um, oh, excuse me. I do think AI might actually help with some stuff, but there has to be a tipping point, basically, or insurance companies need to fail or something like that, where it needs almost like a reset. We need a reset in the minds of how we do people. Even if we do view healthcare as a business, like the product and delivery is just so difficult. And frankly, it's starting to be like inhumane in a way. So the Hippocratic Oath has now become the Hippocratic Oath, and they just get more. They just care about getting you to get on more pills so they can get kickbacks, and you're just kind of more numb, sitting at home, watching Netflix. Not going out in the real world, because I can't go out in the real world, because I had a friend who doesn't want to get in. He doesn't like skier stuff as much because he hurt himself before, and he didn't have health insurance. So he's not going to enjoy a thing that he wants to do in life. If he wants to do that for self-preservation purposes, that's totally cool. But I'm saying the fact that he didn't have an insurance is putting a limit on his life, on what he wants to do. So really, our healthcare system is kind of like the insurance industry's little bitch. Basically, that's like half of the problem, and it's just driven for profit. It's not about healing.
Who all describe the same kind of nightmare scenarios Carmen experienced at DaVita.
Over the years, I believe it went from, care over profit to very quickly profit over care to get as many patients.
Exactly. And remember, guys, you are a fucking customer. You're the customer. From the insurance company, the hospital, and everything. You are the customer. And they treat you like a dog. They would treat a dog way better than you.
Scenarios Carmen experienced at DaVita.
Over the years, I believe it went from.
Over the years, I believe it went from.
Care over profit.
Care over profit.
To very quickly profit over care.
Yep, exactly. It's profit over care.
To get as many patients.
But guys, you're called urgent care. Urgent care. It really should be called, it's an inversion. It's a complete inversion. It should be called whatever the opposite of urgent, like lethargic, don't care. So, I'm sure you guys will think of a creative one, but urgent cares are all over the place. And you know what I mean? And this wasn't a high demand. I was like the only one in there. There wasn't people coming out and stuff like that. There wasn't like a buzz in there, like, oh my God, like, hey, we got a lot of people coming in today. Completely unhurried. Yeah. And I don't want someone to freak out and be like sprinting to go help me per se. I want them to be calm and swift. But it's really crazy.
As they can with the least amount of staffing and hoping that nothing happens.
Hoping that nothing happens. You're at an urgent care. You're at like a mini emergency room. That's the point of it. This is the point. Overstaff it. So why? So it can handle the load when the people come in. It's crazy.
On a bad day, you can get up to 7, 8, 9 patients with one technician.
A manager told one of my coworkers, we were complaining because we were short-staffed that weekend and nobody came to help and oh, well, nobody died. That was the...
Yep. And this is him telling you that. That's exactly what they would say. Oh, well, nobody died, as they just sitting there watching Instagram reels or something like that. This is a part of also the Tylenol brain. This, oh, no one died. This lack of caring, this disconnect. That is also related to Tylenol brain, which we're going to bring that up too.
Response.
One of the nightmare scenarios of dialysis is,
And I guarantee you they're not cherry picking this. And even if they were cherry picking it, that's egregious enough to already be a problem right there. It's not just the one thing they're trying to say. This has been multiplied, duplicated.
patient is hooked to the machine, they go to sleep, the needle dislodges, and the alarm doesn't sound, and they bled out. That is something that I've heard in my reporting numerous times.
My worst experience.
And they need to. Why do they bleed out? Because no one's going to check on them when they're actually like bleeding. It's really insane. I kind of want this one to end. I don't know. I'm freaked out talking about blood too much.
Experience on dialysis was one of the times when I passed out. When I came to, I had no idea that had happened to me. And I was scared. At that point,
That happened to me.
was when I realized I can die on the chair.
That happened to me in the chair in there.
And I won't even know it.
If they're understaffed, you don't
And I wanted to die. I'm just kidding.
have someone watching you every minute. So bad things happen in a short time.
One of the ladies that I used to ride transport with, I saw her walking to the scale, really wobbly and shaking. Nobody was around to help her or able to help her because they were running short staffed that day like usual. So while normally they will escort you to the scale, that was not the case that day. At the scale, she fell. And then next thing you know, the ambulance people are rushing in and
what are they doing? Rushing in. That's what that should have been happening to begin with.
they're putting her in.
Or profitable.
But even when you're trying to run dialysis like an assembly line, things happen. A patient's ride drops them off late. An emergency happens. And
Yeah, there's urgencies that happen.
to catch up, somebody has to cut their dialysis time short. But here's the problem. The doctor has prescribed a certain amount of time for each patient.
Here, that's talking about too much blood and shit for me at the moment. I might need to fast forward it a little bit more, but this is a topic in the similar vein. Oh, gee, pun intended. Jesus.
A few weeks ago, producer Alec Opperman reached out to me with a surprising fact. Doctors are taking out payday loans. That kind of blew my mind. Doctors, as far as I know, make a ton of money.
What do you mean he did it for the money? He's a doctor. He's already rich.
So Alec did some digging, and he uncovered this new brazen strategy in healthcare. It's responsible not only for those scummy loans, but also denying.
And does someone else want to, if you have a healthcare experience or something, I mean, you might have a positive one is welcome as well. This isn't just meant to be like a hater on it. This is the StreamYard link here.
Patients like you and the people you love.
But see how these people are kind of dorks on this more perfect union?
The vital care that they need. And it goes far beyond just our already broken system. So, who's the shadowy supervillain?
They're all kind of like rats.
Behind this plot to rip off both doctors and patients? It's America's largest insurer. This is the classroom for More Perfect Union, and today we're looking at the massive power of United Healthcare. Before we get into United Healthcare...
So, I want to bring this up because this is a representation of the part of the root of the problem. It's not necessarily the company itself, like this one's worse than another. Or I picked this one because the CEO got deleted in the street. I didn't really pick it because of that. It's the biggest, so it has the most influence, I guess. So there's a good chance that some people in here have this and whatnot.
New strategy to shortchange doctors and patients alike, we need to talk about how they became America's largest insurer.
Oh, yeah, and I also want to go back here to the sign. Where's the sign? Sorry, guys, I can't find the United Healthcare sign. But I was calling it United Healthcare because what am I describing to you? I'm describing in there like almost dying because of lazy, incompetence, selfish, not being aware, and it's due to also the Tylenol brain redundancy factor. So that's going to be a new thing. That's going to be a new mathematical thing for this show. Tylenol. We'll call it T-brain. It's redundancy factor. Let me make sure. So this is going to be a rabbit hole here. I don't want to just like bitch about healthcare. So T-brain redundancy factor for Tylenol brain. Okay, it affects. It makes people so they can't like be in the moment and react to anything in the present moment and just be in the present moment. It makes them have a slow processing power, but they're like disconnected. It numbs part of their soul. They're sort of a black-eyed nihilist, but they don't even get off on it. They just kind of like don't give a shit about anything. They're dead inside. Like that amount of them is dead inside. And it also maybe has the only maybe good thing about part of it is they'll like to play like Angry Birds and like Disney and stuff as an adult. Like that's kind of sort of goes along with this. But the T-brain redundancy factor affects about 20 to 25 say 20 to 30 percent. All right, I'm kind of lit. I can't type well right now. Jesus, I put dollar sign down. I did the wrong thing. Okay, yeah. So it affects people's like decision making, their responsiveness time, their humanity, all these things. So that's what was a factor. The Tylenol redundancy factor is at all of these locations. So the redundancy factor in it, it's an inhibitor for everything. Imagine you have a machine running a certain way and it's running good and everything, but you attach on one of the flywheels or something like a 5-pound weight, or it's like very low in oil, or it's the wrong oil, or the gas is just watery. They're just not crisp in the moment. Aware, alert. They don't even have to be a peak performer. They just have to kind of like perform sort of and want to. That we're missing that all across America. Anywhere you go, any of these businesses, these corporate chains. And that's why people don't want to come here and travel, because it's every downtown is the same thing a lot of the times. They got, okay, we'll go to the downtown such and such. Here's the Hilton Hotel, and here's the Denny's, then here's the TGI Friday, then here's the Sephora place, the urgent care, the abortion clinic will be there. And if you need to delete a baby, I'm sure they'll do that stat. They'll come in and maybe help. Maybe I should have said I need to delete a baby, and I would have gotten some service and respect. So that's like what we got going on here. And when you go in, it's someone with Tylenol brain that does it. They're not even like they don't seem like they're on this planet. If that makes any sense. Like they don't, if you're walking, just go to your local grocery store and walk around. People will just like walk right into you like a bug light. Like you're the light and they're just a bug, and they'll just almost just walk into you with their cart and stuff. Or when you need to walk by, they'll just completely like block the aisle and they have no like spatial awareness. They're just checked out. And that Tylenol redundancy factor also goes into driving. These people can't respond quickly when they're driving. The light turns green and it's like, you know, you got to honk at them and like get them going. You have to like keep getting these people going, motivating them and getting it, like coaching them to like just do their job and stuff. And I want them paid more. Being paid more might help Tylenol brain a little bit. That might actually help it, but you get the mentality, the numbness, and it just becomes the norm. Every organization you go into, there's no like energy in there. The norm is like, yeah, we just don't care. We kind of like Tom Brady and Disney though, but you know, we don't care. Yeah, we don't care. I as long as the check comes in, I don't really care. I don't care. Like it's a yeah, pay me or I don't care. Yeah, and I want them to care more. So in this healthcare one is a little bit different. Yeah, I want them to get paid. That's my point about looking at these big companies. United Healthcare makes plenty of money. The CEOs and people who got deleted make plenty of money to give them, like they could all be making 100K and everything will be fine. The company would not lose that much money.
This is the classroom for More Perfect Union, and today we're looking at the massive power of United Healthcare. Before we get into United Healthcare's new strategy
in United Healthcare
to shortchange doctors and patients alike, we need to talk about how they
They're even taking from the patients. I mean, the doctors too. So the doctor's like, oh, well, we have to do a side hustle with the pharma companies pushing Adderall and whatnot.
America's largest insurer. United was found.
Yeah. Again, when I said they could all make 100K, 400, that number is so big you can't even imagine it. It's insane. And they don't want to change that. It's not like they wouldn't make money if they just cleaned up the service a little bit and paid some people different. It would change like the entire world, but they don't want to do it. That's what I'm trying to say here. My health was kind of in the mercy of some jerk off shareholder insurance idiots who told them, oh, you got to leave him in the waiting room for 10 minutes just to make sure. And if he falls on the ground, he already signed the waiver that he can't do anything. So, maybe we'll put him out in the front door and he can just bleed out there. Yeah, this is their mentality. And they say this stuff. They say it. Does U.S. government spend? I'm not sure. And so I live in the United States, so I was saying, United States healthcare. I might have some people, if someone else wants to come on and let me know a little bit more about another country's healthcare. I'm not trying to make it this ain't a dick measuring contest. No one's winning, guys. Like we're not really like winning here. So, you know what I mean? Like, I do think that there are some people who maybe do have a good local doctor, but they have to pay for it and it's been with them a long time. But notice how insurance companies get in as like a filter. They're there to filter you getting any like medicine or healing or care or seen or anything. And they set up a toll booth structure and the scaffolding of the whole thing.
Founded in Minneapolis in 1977 and pioneered a new kind of insurance, treating people within closed networks of providers. Health
1977, Year of the Snake. That's what's on the some of the logos they
HMOs. HMOs were pitched as a way to curb America's exploding healthcare costs, which did not happen.
So this will answer Omni's question. U.S. spends most on healthcare, but has the worst health outcomes among high-income countries. I'm sure he might read the article. So, and I know people are going to say, like, we have the best doctors. And okay, are you getting access to the best doctor? Because I'm not. I haven't, kind of needed it. So, Yorgi is from Greece. Same shit, different countries. Yeah, I would imagine it's really these insurance companies that are just, guys, they're in everything, every aspect of your life, and they always make it worse. Well, some of these are private companies, I guess, too. Yeah, of course they do, because like Canada's not a lot of people, guys, compared to the United States.
HMOs proliferated after 1973 as a result of the Health Maintenance Organization Act, which gave federal grants and mandated employers offer an HMO option to their employees. The law suddenly made HMOs very popular and very profitable. Alec told me about an old nonprofit HMO, Physicians Health Plan.
It's a network of doctors in a health maintenance organization.
And it's going to be some bullshit job that does. It's going to be some bullshit that makes. Watch, this is already what it will be. I already know. It's going to be some bullshit that makes them a ton of money, but they don't serve you. They don't really do any work. Notice that too. The doc, like, I want to see the nurse in there, like, work. How about you, like, she's like, okay, get up and wash your hand and stuff like that. And it's like, I didn't care, but it's like, you can also like help clean my bleeding hand up. Like, that's part of like what you're supposed to be doing here. I'm not asking you to like wipe my ass, but I want you to like not have like me basically do the whole thing. So I'd removed my stitches from my hand today, and it was actually really easy. And I just didn't want to spend the money. I didn't want to deal with being humiliated and treating like a just deal with the system in there. I really didn't want to. It would be a giant, first off, the gas driving down there, but it would be just a waste of my time. There's going to be, to remove the stitches took probably 10 minutes, 15 minutes, including, sterilizing everything, all that type of stuff, talking to the patient and everything. It's like a 15, 20-minute thing, but I know that I would be there for like 4 hours and just feel completely drained afterward. Because they want you to sit in the waiting room with a bunch of sick people coughing all over the place as they play some like retarded kids cartoon in there, and you're just living in like in a hell. You're just living in like in dog shit where they need to be like serving you as a customer. It's really crazy. I live in a small town like that too. I have 6 mouth practice and psychology ward of my youth. Cool. Evil Eddie puts United States, approximately 34 million people. Yeah, 40. Yeah. So it's like crazy.
Minneapolis, and they had hired United Healthcare to manage the HMO. Physicians Health Plan is a nonprofit, but United Healthcare is very much for profit.
Were the doctors happy? Was this a good system for them?
No, they were so unhappy that there was national news coverage that they were threatening to unionize. They were mad that they were being underpaid by United Healthcare, saying it was barely enough to cover their overhead. They were also alleging a conflict of interest with the chair of the
probably some commissioners.
Nonprofit Physicians Health Plan, who was
these nonprofits got, and again, this is another part of the inversion. Nonprofits just make profits all the time. Charities steal 90%. They legally can take 90%. On the right end, because we have a lot of Canadian listeners to this too. Sorry to drag Canada into it. Was just trying to compare because everyone is freaked out about the U.S. style healthcare. Meanwhile, Canadians cannot buy better healthcare privately, even if they wanted to. Yeah. Like if you have money, you can get good healthcare, or better healthcare. But you need to even one of my customers was this older, wealthier lady, but has class. And she said, oh, like when there's an eye problem or something, like you need to know kind of how to complain, but with class. And she's like, you know, and she already has a good doctor, but you need to know, even with them, you kind of have to kick them into gear and everything like that.
Richard Berg.
And who ran the for-profit?
And again, guys, I'll be honest with you. There's a lot of small hats taking from you within this whole process. I'll just leave it at that. They're always a little like, they're always clipping a coin, you know, making a toll. Like all his insurance is like basically tolls that you pay to get care between you and your doctor or you and medicine. That's what like it is. It's just like tolls that you pay.
United Healthcare.
Also Richard Berg. So this man who was running a nonprofit had hired his for-profit company to manage.
I still don't understand what HMOs or a bunch of this is, but I just know that it's going to be like everything that they're talking about is going to be anything but helping like heal and help somebody. That's pretty much all you need to know.
This nonprofit tax-exempt organization.
When you first mentioned Richard Berg to me, I tried looking him up online, and there's really not that much. I tried a video search, and I only found this one video.
The whiteboard video?
The whiteboard video. This guy with a whiteboard that's literally about how it's so hard to find information about this guy online.
He's only mentioned once in United Health Group's own history. He's been thoroughly involved since the beginning, and he's thoroughly involved now. There are very few to no articles about this person. Can you find articles about the founders of all these companies? Gobs and gobs and gobs of them, but not Richard T. Berg. Organizations are not nameless and faceless. I mean, they are groups of people, and people are responsible for decisions that cause these organizations to be the way they are.
But they could be responsible for your life. Like imagine just at some hospital, you go in there and there's just people who kind of like don't give a shit. They're gonna be like, hey, like this is my friend's life here on the line. Get your shit together and take this serious. Come on, like perform here. I need you to like have your head in the game.
Much of United's initial growth was enabled by the HMO Act and the $300 million in grants from the government. Burke and United started snapping up all of these federally subsidized insurers, essentially stealing entire taxpayer-funded organizations. And it makes a lot of sense that the bill was so helpful to United Healthcare. It was written by a think tank, Interstudy.
Interstudy was founded by Paul Elwood Jr. He's this guy who's called the father of the HMO. But I also found another important figure at Interstudy. One of the directors was none other than Richard Berg.
Guys, these are the people that don't care about you and let you die, let your family members die to get like a little. These are the people, some boomer here, who materialism and financial gain is his god. He doesn't care about helping people. He's a sociopath. These people who are doing that are sociopaths. And I know that doctors are one of the highest levels of, I think doctors and surgeons are one of the highest levels of sociopathic people who go to these jobs. It's because they kind of don't care. They want to play God. They want to have the power over you and say, like, I get to influence your health. No. You ask permission from me. You don't go try to help, heal yourself or get healthy, anything like that. And you say, well, doctor, what about the poisons in the food? That's not my department. That's not my department. They're like, well, do you eat any of that stuff? No, I eat kosher food. But you can just keep eating slop, and what we do is we'll just give you, is your back hurting you? Just keep taking some more Tylenol. That's all.
United grew from a regional.
That's why we have the kids flavored Tylenol.
Group of HMOs to a national insurer with a
just numb it out.
Breadth of plans. Like other insurers, they claimed their growth would be helpful to the average American. The bigger they got, they said, the better they could negotiate with healthcare providers and
pass the savings on to you.
Which did not happen. A wave of mergers and acquisitions in the insurance industry in the 90s wiped out the patchwork of regional nonprofit insurers that had already existed. Companies like Anthem went on a
so when he's saying regional nonprofit ones, what they're talking about is eliminating competition for this, eliminating marketplace competition, eliminating that incentive to be like, you know what, I actually have to pay a little more to this one, but they actually treat me awesome. I like the lady that works there, and I have this doctor who's really good, and they actually give a shit about me. that is kind of going away because when you have 3 companies controlling it, they're like, just put some like completely robotic person in there. And soon it will be like, it may as well have been AI waiting on me in the waiting room, because that would be less insulting than a human that just doesn't really give a shit about you in the waiting room.
Industry in the 90s wiped out the patchwork of regional nonprofit insurers that had already existed. Companies like Anthem went on a shopping spree for these nonprofits and added them to their for-profit empire. At the same time,
Again, guys, you guys are having family members die and get sick and not prevent things or do things the right way just because of incompetence, people not getting paid enough. There's greedy people. We need these people paid well, but there can't be so much greed at the top here. These people they're more interested in keeping you sick and not healing you than anything else.
It continued to consolidate and spent.
I guess these are very parasitic by nature. They need to feed off of you in a way.
Billions acquiring other for-profit insurers. Despite their promises, healthcare costs continued to increase. But they were getting more efficient in one crucial way.
And I don't know when people are going to start getting mad enough.
Rationing your healthcare. For years, only a small portion of claims got denied. It just wasn't cost effective to have a human review every request for care. But today, nearly 1 in 5 claims are denied. In 2021, that added up to nearly 50 million. 50 million instances of Americans being told, no, we won't pay for that thing you need to live a healthy life.
Yep, delay, deny, defend, whatever that is, and we'll go into that a little bit later. But that's what they do. They've created AI algorithms that just help deny your health care easier.
Think about it. You pay a premium every month to United Health and other insurers for health insurance, and they mostly focus on making sure that they won't have to foot the bill.
Yeah, that's their job. Their job is to take your money and then not serve you and keep that money that they've already had. And by the way, when they do need to serve you, they just jack the bill up even more anyway. So don't worry about that. So it's very sinister. This is the key of corporate greed and all that. It goes beyond corporate greed, in the sense that we can't stop buying fidget spinners or something like that. No, this is like people are going to need a healthcare, and we have enough money to do all this, but these people just keep it so greedy. And people like RFK come in and stuff, and they don't do anything. What has RFK done? Just tell you that Tylenol makes you autistic and gives you Tylenol brain? That's all he's done.
You can appeal denials, but insurers do everything in their power to make that super difficult. Only 1 in 500 cases are appealed. There are 500 sheets in a ream of paper, and those fail 59% of the time, leaving this little sliver of paper as...
And you'll go to legal battles for decades. So the only time they ever show you this, so if you go into the hood, you go into a very poor suburban area, sometimes a well area, but really any area, what are you going to see? All the billboards, all the benches and stuff. You call this insurance attorney at law. You call Shyster, and Shyster at law. You call Mr. Greenstein, Mr. Feinstein, and we will get you the compensation you deserve. That's people's idea of like striking it big, getting rich, getting out of the system. That's like their idea of winning, is some like trip and fall insurance scam or hoping someone messes up in a medical procedure. That's like they're breaking the bank. And really all the insurance people are doing, or the lawyers on your end are doing, is just holding the insurance companies to the basic accountability. That's pretty much all that they're doing. And they know that these insurance companies have enough to pay out these huge numbers, so they take it. And insurance companies, I'm sure, add in sometimes so when they get busted. So they probably keep $100 million. What I'm trying to say is this: they would rather keep a retainer of like $500 million that is for just in case lawsuits or when the lawsuits come up, because they're so used to saying no all the time. So now and then they have to take a couple $10 million hits or anything, but it doesn't really hurt the big company at all. The little people feel like they're winning, and you get kind of a small win, but not really. The overall problem is still Flintstones too. That's what they have. I'm telling you, the Tylenol redundancy factor is a big factor for the people who work in healthcare and stuff.
The lucky ones that got through compared to all of this.
The show isn't about the Tylenol, but we'll do a Tylenol brain and make a certain formulation for it, kind of like how I made one for the drinks with the SSRIs. We've also coined Floyd's law on here as another mathematical equation. So this one will be, and we've also done another one too. Something plus emotion makes action. I forget what that one was at the time, right now.
These are worth billions of dollars for insurers. So what the hell is going on here? Let me explain. As these companies grew and got some of that sweet, sweet economy of scale, having entire departments of people to look at claims and deny them became way cheaper.
I found an older newspaper article where a real person's job title was simply denial nurse.
Denial nurse.
Yep, and I know people who have done something similar to that. Someone that worked for Liberty Mutual, and actually a girlfriend that I had, she got a job at Liberty. She was out of college, and she got a job at Liberty Mutual, that insurance company with that goddamn Doug and Emu and stuff. And she could work remotely from home, but she had to basically mostly deny people her claim. And she said it was like hell, that it was like killing her to just deny people personally over the phone. I think she had to quit it and leave it and stuff. And they were a company that actually paid really well and gave a lot of good benefits. Actually, it was kind of sick.
Denial nurse.
It isn't just nurses.
Part of what I'm trying to say is, if you have Tylenol brain, you don't mind that you are denying other people care and stuff, and you just get kind of mediocre care, but you're denying other people. You don't give a shit about any soul level type of stuff like that. That's a part of that's one of the things that Tylenol brain makes numb, is you being in any type of chain of events or having any type of consciousness, or Russia, they call it sovist, which means you don't have any type of soul or feel any guilt or shame or pride or anything like that about the situation.
Poring over claims,
or patterns of behavior, I guess,
for excuses to deny them. Tech plays a role too. Dr. Alan Mooney, an executive at United, pioneered a system that allowed for bulk claim denials at rapid speed. United's aggressive denial or underpayment of claims has made them
it's like whack-a-mole for them. So something comes up, you just deny it, deny all over the place.
Target of
they call that Yiddish whack-a-mole.
Tons of lawsuits.
They're losing a bunch of cases. They were sued by two healthcare groups, Team Healthcare and Envision. The things that they were alleging in these suits that they won was gross underpayment and mass denial of claims, right? So in the case of Envision, they were rejecting nearly half of all the doctors' claims for medical care.
Huge hospitals have...
And notice that the doctors also, too, they don't care. Well, the janitor needs to be paid more, and the people that work at the cafeteria. No. Just them. Only them.
Very expensive, well-staffed billing departments to chase down.
They got the underlings to sign the waiver, I'm sure, but just them. Just them.
On insurers for money, but most small practices don't have that luxury. But denying claims is just the start of United's plan to pad their profits at the expense of the patient. Which brings us back to the payday loans.
While I was reporting this piece, I reached out to one doctor who was publicly complaining about that.
I've never taken a payday loan ever. But I'm assuming it's just a loan that you get that will come from your next paycheck. I would imagine.
The payday loans from United.
So it sounds kind of retarded, but I haven't I would imagine that's what it is.
Doctor emailed me this report, and the number in there that they pointed me to was that 41% of healthcare providers needed to take out external funds to stay afloat. So like loans, stimulus, etc.
This is why doctors and
Well, these doctors are also greedy too. They're, they need a Porsche. They need, they also do kind of nig their money.
Practices end up needing to take out.
In fact, someone told me like doctors usually have like the worst credit, and they just spend like absolute morons.
Out those predatory payday loans.
They have enough money to come in to kind of keep it going, but they're actually like financially cooked.
Appealing a denied claim can take months or years, so companies will front providers that money as they hope for insurer payouts. So United Healthcare's constant denials can be very, very profitable for a payday loan lender, which really works out for United because, of course, they own one, Optum. Optum not only speeds up claim processing to United and other insurers, they offer something called Optum Pay Advance.
Oh, God.
They must have known that sounds terrible because they've since rebranded that service.
They just see how this is what I'm talking about here. See how they're creating all these companies and everything to like screw you over sooner. But yet when you walk into the health clinic, you can't get served. You're bleeding out. I almost should have taken my hand and make the blood go like all over her computer and stuff and be like, can you get this started now? Do I need to write with my bloody finger all over the walls, get your shit started here? Is that what we need to do here? That's what I should have done.
Service to the more.
But then they call, if you get aggressive like that, they call you crazy, then I would have ended up having to call an ambulance and stuff. So I didn't really want to escalate the situation because I was kind of scared. Like it didn't hurt. This wasn't a painful thing. I just realized like I don't know, blood just kind of like was freaking me out.
Sterile capital loan. When capital loans aren't enough for small practices, there are plenty of companies in the market to buy struggling healthcare providers outright, like Blackstone and CVS. But most importantly, United Healthcare, now the largest employer of physicians in America.
Yeah, but Evil Eddie was kind of the one that he said he used to take stitches out from doing Muay Thai or some type of UFC fighting or something like that. He said he would get stitches frequently. So he ended up taking them out. I'm kind of glad he told me that because that opened my mind to think like, wait a minute, maybe this isn't really like a big deal. I can just take them out. And it wasn't a big deal at all. And like I had it at the kind of the perfect spot to do that, safely and stuff. And it just saved me so much stress from dealing with all the bullshit. I don't want to go through another soul-sucking humiliation ritual and be around sick people in there with a cut on my hand.
70,000.
They probably give you an infection at the place.
United's strategy is called vertical integration. It's part of an ongoing process that gets United Healthcare a cut of every single step of the healthcare process. Say you're uninsured. You injure your knee and go to an online pharmacy for some Advil. While you're
Tylenol. It's Tylenol. That's what they prescribe. I'm not even telling you. A couple years ago, like maybe a decade or two ago, I was having like my knee was kind of hurting me and stuff, and I was in the doctor's office, and this is kind of when I didn't go as much or care about or seek alternative different doctors and everything. He was like, "Oh well, just you're kind of up and down a lot for your job, doing tree work or landscaping or what kind of like whatever I was doing at the time." And he's like, that's just going to happen. He didn't even like bother to like hit the hammer on my knee and like take a look at it or do anything. That's what I'm saying, guys. The level of care, it's just like they don't give a shit at all.
Hopping around, you see an ad for a doctor specializing in knee pain. A few clicks later, you're scheduled for a knee replacement. The surgery is obviously pretty expensive, so the doctor refers you to a service offering.
Let's just replace it. Let's not even consider trying to heal it, like at all. So that's another thing too. They want you to replace something rather than heal it. They were like the dissolvable ones. I didn't have so most of the time they have dissolvable ones. I took the strings out because I'm a man.
Loans to people like you. Faced with thousands of dollars in medical debt, you start considering a health insurance policy. In CEO Andrew Whitty's vision, every part of this process, the pharmacy, the doctor, the loan provider, the insurance, are all run by the same company, his.
There are very few companies in America that have a relationship with 100 million Americans, and none that have a relationship as intimate as healthcare.
Already, United Healthcare
Yeah, and you don't give a shit, and you're doing a shit job at it.
members might be told
See how it's just another pyramid scheme.
they're required to purchase specific drugs from a hand-selected pharmacy.
Welcome to Optum RX.
Optum. Sound familiar?
Working every day to take care of your pharmacy needs and make sure that you get the most out of your new benefits.
Well, insurance.
They just lie to your. Just look at this guy looking you in the face and lying. This is a sociopath here. This is a black-eyed nihilist. This is what. So this guy doesn't have Tylenol brain. He knows what he's doing. But this is the eyes of Tylenol brain sometimes. Deep, dark, black, kind of demonic but dumb, and just lack of giving a shit at all. And they'll just look you in the face and not like give a shit.
Insurers say their big happy healthcare family will save you money. It's more like a personal health dictator. A dictator who has a legal responsibility to make as much money as possible. And they're doing a really good job. In 2010, United is worth around $35 billion. Today, it's worth more than $450 billion. When insurers aren't using their savings to invest in vertical integration, they're using it to enrich their shareholders. In 2022, for instance, 7 major insurers, including United Healthcare, generated nearly $70 billion in profit. And
Profit! Again, that's in profit. That's not like they had to pay their expenses and stuff. That's the take home.
To spend $26 billion of that in stock buybacks. And of course, the executives, the characters you've met so far, are winning too. Richard Burke retired from the United Board in 2022 with an
just a small hat, another pyramid scheme of stuff. And guys, they're playing with your life here.
Estimated net worth of $500 million. And while United executives like to speak of firewalls between their business branches to work,
no one's holding these people accountable. Your Congress is not. Your government is not. Your bankers are not. Your local commissioners are not. You're not. Your neighbor's not. Your mayor's not. Your governor's not. Your provincial leader, whatever you want to call that, is not doing it. Your president. We're so used to being beaten down that we don't give a shit. Yeah. Always get to a patient. I don't like cutting open the body. I like yeah. Well, I'm not giving anybody, health advice here, clearly. This is just for entertainment. I'm talking about systemic issues here. All this stuff is the DNA of the problem.
Of conflicts of interest.
Because we pay enough that we should get amazing care. Guys, it's 2026. If we're not going to be getting good care now, we've really messed it up here. We are responsible for upping the standard of care.
They have been busted for using their subsidiaries to manipulate the market.
New York's Attorney General charged you.
And I want to see doctors and nurses step it up, pharmacists and people step it up. Stop just playing along with the system to get a little bit more money. You know what I mean? Your kids are going to have to grow up in this.
United Health Group with using a research firm the company itself owns to manipulate reimbursement rates.
That's problem, reaction, solution. So there'll be a prop. They can do the whole thing. They can scan. It can be a nice in-house scam. Nice little shell company, shell corp gig going on.
The firm was called Ingenix, which you might have guessed shut down. Nope, they just rebranded as Optum Insight. Today, Envision alleges that United uses its negotiating power to lower reimbursements for practices or to kick them out of network, putting them in the kind of financial distress that would allow Optum to swoop in and acquire them. The Department of Justice tried to stop United's acquisition of Change, Optum's competitor that facilitates the exchange of claims information between providers and insurers, but in spite of United's history with Ingenix, the judge took CEO Andrew Whitty's word that sharing of competitor info would be against, quote, everything we stand for in the organization. With this merger, United will have access to a trove of data on what other insurers are paying and what they've negotiated with doctors and hospitals. This could
it's gatekeeping. It's gatekeeping.
allow them to unfairly undermine the competition, further cementing their healthcare monopoly.
It's also worth mentioning that before he was the CEO of United Healthcare, Andrew Whitty was the CEO of the drug maker GlaxoSmithKline.
While Whitty was in charge, GlaxoSmithKline paid $3 billion.
But do you see how it's all connected with each other? And we're not bringing up even food yet either. So that's another thing too. The woman was saying, oh, this is what our healthcare provider tells us to do. It's like, bitch, you are the healthcare provider right now in front of me. Get some gauze out and shit and fix this. For what the fuck?
For fraud, including but not limited to bribing doctors and, quote, encouraging the prescription of unsuitable antidepressants to children.
Yep. No surprise. And Tylenol.
It's an organization with a great ethos, a belief in doing things with integrity, a belief in putting the patient at the heart.
Same sociopathic eyes here.
Of every decision we make.
Like a jewel thief who moonlights selling security cameras, United has found a way to profit even more off of the havoc that they wreak. If their practices bankrupt your doctor's offices, they can give them a loan or acquire them for dirt cheap. Then, if your medical provider disagrees with United's unwillingness to pay for a CT scan, they'll have to keep in mind that the people they're arguing with are their...
And they make you beg for preventative medicine. Beg for preventative medicine. An ounce of prevention is worth a pound of cure. For them, an ounce of prevention isn't worth a pound of flesh. They don't give a shit about that. They want to cut your flesh off. They want to cut you up all the time.
Employer, their owner. If you can't afford your deductible, they can offer you a loan. When you're looking up information about medical procedures, the article might be written by someone on the United Health payroll.
Yep. So another one that I wanted to go over is the American Dental Association. Those crooks. Crest is the only recommended brand by the American Dental Association. We put a dick ton of fluoride in it, and your teeth are cooked anyways. Your teeth are just pretty much cooked anyways from the sugar and the sugar alcohols and all the bullshit we put in our food. So they're kind of cooked anyways, but make sure to use Crest so the ADA can keep their monopoly going.
Who now has an incentive to push treatment good for United's bottom line. And for Whitty, United is just getting started. Quote, despite our size, we're just scratching the surface of the opportunity, he told a group of investors.
To screw you over. The opportunity to take your health, clip your coin, clip your health.
If 40 years of consolidation has taught us anything about health insurance, it's that big is usually bad. While companies like United will always frame their growth as a way to help you, their relentless rationing of healthcare shows it's anything but. They've done it with automated denials, and they'll continue to find innovative ways to protect their bottom line as they acquire more and more healthcare businesses. So what can be done about this? Vertical integration has been a very convenient way to escape antitrust measures for insurers like United, because regulators are accustomed to only...
And they just need to go to your local commissioners. Your insurance commissioner holds a lot of power. Your local insurance commissioner holds a lot of power, and they can take a bribe. These are the people who go to Yale and Stanford and get these fill-in jobs that when something like this comes up, they just have to take the opportunity and do it, and then just kind of keep the books relatively neat and, play dumb. Deny, delay, defend, deflect, all that when you need to try to hold them accountable. Excuse me.
Scrutinizing acquisitions that remove their competition in the same space. In this case, insurance. United isn't even the only problem. Their vertical integration strategy is spreading across the industry. it isn't too late for antitrust regulators to start scrutinizing when companies like CVS or United Healthcare are buying up anything and everything. So, how have the healthcare monopolies affected you? Share your insurance.
So let me go back and finish this damn dialysis one right here.
To sit in
Because
a
it's
chair
the same exact
with a certain
theme.
amount of blood being pushed in and out of their system. If I need 5 hours of dialysis and I'm only getting 4, it's not cleaning my blood as much as it should. Toxins can build up in my bloodstream, making me sick.
One of the most unambiguous findings of medical research in dialysis over the last 30 years is that shortened treatment times shorten lives. It's very straightforward.
Now, if a patient wants to cut their dialysis time short, they need to sign something called an AMA, a document basically saying you want to do this against medical advice. But at DaVita and Fresenius, it's not always willing.
We would ask the patient to sign an AMA, even though it's not the patient's fault. But
a small hat came in and told him what to do. And this guy had Tylenol brain, but came out of it somehow. So good for him. This guy had a soul, stood up, walked away from it, and put the Tylenol numb lifestyle, came down and starts to own up to it. This is good.
we have a schedule to keep with the next patient.
That's the fast food model of healthcare, where the chains want patients on that machine for 3 to 4 hours.
This is economist Ryan McDevitt, who studied the business of dialysis extensively.
If a patient needs to be on the machine longer today, they have another patient supposed to come in for their session where they're going to get another reimbursement. They don't want to adjust the schedule to accommodate that patient who needs a more personalized type of care.
But here's the problem. If you want one of the limited kidneys available for transplant, disregarding a doctor's order looks really bad. One DaVita patient I spoke to claims she was turned down for a kidney transplant in part because of these AMAs on her medical record. A kidney transplant means not being trapped in a chair for hours a week, it means living longer. But transplant organizations don't want to give kidneys to people that they feel won't follow a doctor's orders. Another problem in the dialysis industry is that the very system designed by Medicare to keep clinics.
See how they're just putting up more tolls, more blocks, more things for you to go around for you just to get actual help. More money, more inconveniences. They're letting the disease soak in the whole time. That's what they love to do. They love to just like let you have the state of disease just soak in. You just sit at home and wait for this. Okay, we'll look at that in a couple months. You just keep letting it fester and grow. Okay? You just keep letting it fester and grow, buddy. Then maybe we'll cut it out later.
Accountable has been gamed by DaVita and Fresenius.
They have an incentive to push out patients who are going to harm their scores. And so most glaring aspect of this is when a patient is kicked out of the facility. And they'll find different nefarious ways to do that. We've heard anecdotes where they'll trump up charges on a patient, say they've been disruptive or they threaten staff. But
exactly. They become disruptive or threaten staff or something like that. That's what I'm saying. They will create a way. Listen to what he just said. This is really important. This is why I didn't start bleeding over the computer and be like, can you help fix this now?
Yes.
They have an incentive to push out patients who are going to harm their scores. And so most glaring aspect of this is when a patient is kicked out of the facility. And they'll
that goes on your record.
Find different nefarious ways to do that. We've heard anecdotes where they'll trump up charges on a patient, say they've been disruptive or they threaten staff. But what it does is help them look better on the report cards. And that's important because if they
to their slave masters in the small hats on their report card. See how much I didn't help people so you could have more money? That's what they're doing. See how much I didn't help people that we took their money anyways. That's what insurance, how it works.
They fall short, they will lose.
See how we didn't actually provide any service, but we took even more money than we did the previous year? This is awesome. We're literally killing it.
% of their Medicare reimbursements.
Another glaring example of juicing their scores involves ambulances.
Juicing their scores.
When a patient gets sent to the hospital from the clinic, it's a sign something has gone wrong. And so it hurts your score.
My blood pressure shot sky high. I mean, really high. I'm like, shouldn't we be calling the
The only ones they will hack are probably like 23andMe, who was run by a woman that got bought out. I think that got kind of like hacked and bought out. They, even if they, that's the thing, Evil Eddie, even if they did release the data is kind of already out there in a sense. So, but I mean, I love for some hackers to come in and start doing shit.
ambulance? They're like, no, we're going to get it down. We'll get it down. We'll get it down. I'm thinking, if you don't get me to the hospital, I'm going to have a damn stroke. I never got an ambulance until
because you're not.
So I put my foot down and I said, either you call an ambulance or I will, because I really don't give a damn about DeVita's numbers.
I've actually heard an incredibly similar story from another.
And that's basically what I almost had to do.
Patient at an entirely different DeVita location. Allegedly, a man was repeatedly fainting while another patient pleaded with staff to call an ambulance.
Whenever there's a dollar at stake, the for-profit chains do everything they can to chase that dollar, even if it comes at the expense of patient care.
Now, if you're wondering why these patients,
and a lot of elderly care places treat the people like garbage too,
just can't go to another company for dialysis instead of the emergency room, well, DeVita and Fresenius have been on a buying spree. And Ryan McDevitt studied what happens when they buy up other clinics.
We use this quirk in Medicare data where we could look at the same facility, same patients, before and after DeVita and Fresenius took over. Hospitalization rates went up by about 6%, death rates go up 3%, and most alarming, transplant rates for the patients during their first year of dialysis fell by almost 10%.
Now you think, well, why would that be? It seems.
I just want to see, when I hit a star on the comment, I just want to, I'd have to go log into YouTube here to see if that does anything.
To me, that if you want to maintain your cash flow, you don't let people off dialysis. That sounds a bit sinister, but it just is a matter of incentives.
More alarming is that when patients do push back and advocate for themselves, the consequences are sometimes dire.
In my experience as a reporter, patients who speak out about their rights, patients who are a little bit difficult, patients who don't agree immediately to be passive subjects of care, are quite often targeted for intimidation and sometimes pushed out of their clinics. When you're pushed out of a clinic as a dialysis patient, your lifeline is cut.
This fear has been a consistent through line in the history of dialysis. In fact, 25 years ago, Republicans sent.
Yeah, Red Cross is also a very corrupt organization too. So yeah, this is, I mean, it's got to be talked about.
Chuck Grassley held a hearing on dialysis and couldn't find many patients willing to go public. He expressed his frustration by saying, they must dialyze to live. That fact alone has discouraged many patients interviewed by this committee from coming
forward. Because if they said anything about it, these companies would be like, all right, well, we won't serve you anymore. That's what I'm saying. It needs to be understood how quickly they will let you die. If they're willing to quickly let you die, it's like, why are we paying them to begin with? Viral story of employee doing kidney to her boss, only to be fired by the boss, involves Debbie Stevens, a 47-year-old assistant to Atlantic Automotive Group dealership in Long Island. Nice.
Or today to publicly testify.
Again, I'm thankful that I haven't had to do many hospital visits. This is actually, like, I think one of my first times even getting stitches. So, I try not to really go to the hospitals, deal with it much, things like that. So I'm fortunate in that sense. So, I mean, part of that could just be also luck too.
Quite often, because you've been discharged, you're not.
But I will also want to say this too, how I've brought up on one of the previous times how valuable your attention is. If you're paying attention, very good attention, your likelihood of getting hurt goes down a lot. So if you want to prevent accidents in life, if you're paying attention, being aware of your surroundings, checking things, out, listening to your gut instinct, that's very valuable to not having to go at all.
Accepted at other clinics. You're blackballed in the area where you live. So your last resort is the emergency room, but emergency rooms aren't set up for chronic care. So they don't actually treat you until your blood is so toxic, your whole physiology is so messed up that you're about to die. Of course, this yo-yo effect on the human body is disastrous and leads to, rapid demise.
DaVita and Fresenius collectively today own about 80% of facilities across the country. They systematically gone and bought up over 1,000 independent clinics.
One way they've maintained this duopoly, Ryan alleges, is by bribing kidney doctors.
They're paying kickbacks to nephrologists to get them to refer more patients to the facility. So DaVita and Fresenius have collectively paid over $1 billion in settlements and fines over the past decade or so.
But Evil Eddie's story here, let me just actually go and read it out. Because this will kind of also goes to the point of the show here. Thanks, Evil Eddie's awesome. The viral story of an employee donating a kidney to her boss, only to be fired, involves Debbie Stevens, a 47-year-old assistant at an Atlantic Automotive Group dealership in Long Island, New York. After the surgery, Stevens suffered medical complications and needed to take sick leave. She alleged her boss began treating her horribly because after she donated it, and so it took a toll on her body, berating her, demoting her to a less desirable office, and eventually firing her in April 2012, citing performance issues. Wow, what a soulless a-hole. Well, that's why, because the sociopaths that don't care get into these CEO positions, and they're doing just great. That guy made another $50K that year, probably, and he'll fire her. That is who is getting rewarded. That's the inversion. It really should be that she donated the kidney. Now she gets way more money and gets treated like gold. Gets really secure employment, gets really good 401k benefit or healthcare benefits, all this other shit from the company. Nope.
They view it as a cost.
And they'll promote that guy. They're like, oh, we actually love that. You should come work for United Healthcare.
Business for them is like paying their
rent.
rent.
Ever thought about doing some healthcare work?
Or paying employees.
With their duopoly cemented, DaVita and Fresenius have been able to aggressively enshittify dialysis with no repercussions.
Well, it's heartless, but it's also the T-brain factor, the Tylenol brain factor. They're just kind of numb, dumb, soulless, kind of sheep, sort of black-eyed nihilists, but love like Disney and Netflix and like tattoos.
Sam and Manny have been organizing with United Healthcare workers to fight for better pay and more staffing at Fresenius and DaVita. Manny alleges Fresenius has been retaliating against workers involved in unionizing. Carmen is lucky. She got a kidney transplant, but she is still fighting for better working conditions for the dialysis workers that kept her alive.
They take care of us. They're responsible.
Good. She's getting out and bitching about it. That's good.
For my.
And this is a boomer that does give a shit because it affected her, which is good. If this didn't affect her, she probably wouldn't have given a shit.
Kidney. My brand new kidney is going to be 2 years old tomorrow.
If you have kidney failure in the United States, you're worse off than almost anywhere in the developed world.
Patients in America die sooner than anywhere else in the developed world. They have a 20% annual mortality rate. Compare that to Europe, which is 12 to 15. Compare that to Japan, which is 6%. It's radically different. So American patients die 2 to 3 times faster.
The dialysis industry strongly objects to the way Tom characterized their business in his book. They did so through lawyers.
I sent some of the stronger statements to the major dialysis companies. And some didn't answer, but others, via their lawyers, wrote back and said basically I was full of shit. I was completely wrong about everything. And to me and to my publisher, that was an attempt to block publication of the book. They didn't say it in so many words, but
yeah, see, they don't even want you to like they don't even want you to begin to even think about reading, to even think about do anything to make you even think about holding them accountable. They got you like 35 steps away.
I suggested
33 steps away, I should probably say.
This was libelous.
In 2019, before Ryan McDevitt's damning publication about dialysis chains, the editors of that journal received a lengthy email from a DaVita executive. It includes a laundry list of complaints that, if true, would likely have gotten the paper retracted, according to McDevitt. After he and his co-authors responded, an editor called the complaints silly and confused. The DaVita and Fresenius model are not unique to dialysis. They just have the perfect set of customers, people who need to show up 3 times a week or die in short order. But hospitals, doctors' offices, pharmacies, even veterinary clinics are being consolidated in similar ways.
That's one of the few things that everybody can agree on, right, left, and center, is that our healthcare system is broken. And dialysis is just sort of the worst case scenario of what can happen when you totally focus on profits and on Wall Street and turn the other cheek to human harm.
The model is the same. Buy up local businesses and aggressively cut costs. It doesn't have to be this way. Nearly every other country in the world has figured this out. Thank you so much for watching. If you work in dialysis or any other part of the healthcare industry and have a
want to check on this guy here. I like what he has to say a lot, and I think this might also be relevant. Let me restart it. This is like a Muslim dude, but I like this guy. Oh crap! Damn it! Sorry about this. Hang on. Damn it! Sorry. This is a one monitor problem. Fuck. I was just letting this thing play for a while. My bad. I'm sure you can. You hear me now? The video should have sound too.
See, this is part of what corporate democracy
My bad.
means.
I got to get 2
terms of
monitors going
within a company.
See, when I'm doing this, I can only have one thing up at a time and like show you. So I had this like playing, but it wasn't like showing it to you. So my bad. And this looks like a really powerful video. So this is like a Muslim guy that we check on time to time here. And he's kind of talking about something. I didn't pre-watch the video, but I would imagine it's parallel to the issues I was speaking about.
See, this is part of what corporate democratization means. I mean, in terms of within a company, right? I mean, the basic concept is that we need to deal with corporations as political entities because they are political entities. They have more day-to-day influence. They have more control over our daily lives than the government does. That's the truth. And we spend more time, or anyway, the biggest single chunk of time is spent on the job. And corporations behave in a really purely totalitarian or authoritarian manner. And of course, in the West, no one even thinks that so-called democracy has any place in a company, has any place in the office, right? You leave your democracy at the door. When you clock in at work, you clock out of your so-called democratic system. I mean, obviously, the truth of the matter is that you don't have that outside of work either, but they don't even pretend that it's even supposed to exist at work, that it's even supposed to exist at the workplace. Never mind that you actually spend more time there than anywhere else. So you live in a so-called democratic society in which you spend almost every waking hour inside of authoritarian institutions, controlled by authoritarian institutions. So the point is, those institutions which already functionally govern your day-to-day life, those institutions should operate in a way that is more appropriate given their disproportionate role in the lives of the workers. You understand me? Again, like khalifas, like stewards, like trustees, like custodians, and so on, right? Your work life inside the controlled environment or the controlled ecosystem of a company should be more like or more in line with the way that your society is supposed to operate and the way that the power structure in your society is supposed to operate if the declared values of your society mean anything whatsoever. You understand me? Because you're partners in that company. And the truth of the matter is you're the partners in that company. You're only not regarded as partners because you don't value labor the same way that you value capital. But there's no actual reason why that has to be the case. That's the way the West has done it, but it doesn't necessarily make sense to do it that way.
What did he just say here?
This is part of
you don't value labor the way you value capital.
And the truth of the matter is you're the partners in that company. You're only not.
We are the partners in this company. That's what he's talking about. This is very powerful. I even might let it play one more time.
Regarded as partners because you don't value labor the same way that you value capital.
You don't value labor the same way that you value capital. And in this case, applied to the healthcare industry, you don't value human health the same way that you value capital.
But there's no actual reason why that has to be the case. That's the way the West has done it, but it doesn't necessarily make sense to do it that way. See, this is part of what corporate democratization means. I mean, in terms of within a company.
Yeah, I don't blame you, Liberty.
Right?
Like,
I mean, the basic concept is
I understand that a lot of these people have to do self-preservation too, and it's easy for me to just sit here kind of talking shit on the internet, like, but it's good to stimulate a conversation about it and understanding the DNA of the problem, the mechanisms of the problem, where it's coming from, and it's really coming from mostly insurance companies.
We need to deal with corporations as political entities because they are political entities. They have more day-to-day influence. They have more control over our daily lives than the government does. That's the truth. And we spend more time, or anyway, the biggest single chunk of time is spent on the job. And corporations behave in a really purely totalitarian or authoritarian manner.
Yep.
And of course, in the West, no one even thinks that so-called democracy has any place in a company, has any place in the office, right? You
you just do what your boss says and shut up, right? Or like Liberty had put, and this is not to criticize Liberty. Liberty thinks for himself, and he's awesome. But he worked in healthcare, and he's taken some time off from it and whatnot. He says, my new rule after I return to work: only speak when spoken to, say and do the minimum. Why? Because he said, not this. It was you learn doing anything extra only puts a target on you. So, you know, that's part of the game, you know, being oops, sorry, I'm messing around with some of these other ones. That's the game being played here. So, you know, this is not me telling you guys that you need to do this and stuff per se.
Democracy at the door. When you
guys pretty much get it.
Clock in at work, you clock out of your so-called democratic system. I mean, obviously, the truth of the matter is that you don't have that outside of work either. But they don't even pretend that it's even supposed to exist at work, that it's even supposed to exist at the workplace. Never mind that you actually spend more time there than anywhere else. So you live in a so-called democratic society in which you spend almost every waking hour inside of authoritarian institutions, controlled by authoritarian institutions. So the point is, those institutions, which already functionally govern your day-to-day life, those institutions should operate in a way that is more appropriate given their disproportionate role in the lives of the workers. You understand me? Again, like khalifas, like stewards, like trustees, like custodians, and so on, right? Your work life inside the controlled environment or the controlled ecosystem of a company should be more like or more in line with the way that your society is supposed to operate and the way that the power structure in your society is supposed to operate if the declared values of your society mean anything whatsoever. You understand me? Because you're partners in that company. And the truth of the matter is you're the partners in that company. You're only not regarded as partners because you don't value labor the same way that you value capital. But there's no actual reason why that has to be the case. That's the way the West has done it, but it doesn't necessarily make sense to do it that way.
Okay. So I think I think I talked kind of enough about that. We did close to 2 hours on that. So I don't want to beat a dead WHORSE. And let's change it up here and watch some body cam footage. In fact, we're going to take a quick little brief break, and you're going to listen to this. Take your smoke break. Take a small break. Evil Eddie made this song. Check it out. Song of the week. Going to take a small musical break. But Evil Eddie plays some of these tunes.
I was lost in circles, head full of noise. Everybody preaching, but nobody builds boys. Cold screen prophets selling weakness by design. No old wolves beside me to show me how to climb. Iron sharpens iron, pain becomes control. Brothers in the fire, teaching damaged souls. We don't need another lecture. We need mentors. Heavyweights and hard truths and real damn brothers. Barbells in the basement, steel inside the chest. Men survive together, that's when we're at our best. Old scars on old hands, stories in the smoke, lessons in the gym light between every joke. Late night garage talks, engines growling low. Strong men build strong men, That's how the good blood grows. No savior coming, no easy cure. Find a crew beside you and suffer to endure. Lift heavy, fight harder, stand your ground again. The road back to meaning starts with better men. Starts with better men. Down dignity, a tax press and a brotherhood can drag us all from hell. Real men, God, real men, can teach them to stand well.
But I do need to go. So can I move this?
No. The road's closed.
But that's what I'm saying. And all these residents, there's only one way out.
I understand, but it was advertised.
Yeah, so they told me to move my car in here.
Right, but the road is closed and we can't let people out, okay?
Okay, so like I said, I apologize, but I'm not going to do this.
No, you can't.
Yeah, man, I was muted actually. So, yeah, sorry about that. Let me rewind this. So, yeah, that music was from Evil Eddie. I was talking about it a little bit when I was in there. It's one of the songs of the week that he's done for me. It came out awesome. So we'll incorporate some of those musical breaks, and I also want to show some other work that people have done, subscribers and stuff, music that they've made, and other things like that too. So this is a woman. This video is called "Woman Drives Through Crowd Because She's Late." I haven't seen it, but I wanted to change gears. I don't want it to be all doom and gloom and bitching about healthcare and stuff like that. Yeah, the music is cool. He has a whole playlist, and some of them have lyrics, some of them don't, but the lyrics are actually pretty dope. So they're, I actually do listen to it. Yeah, we need some laughs. Yeah, exactly. We'll lighten it up. That's why I was taking a break. We'll reset, and now we can just kind of screw off.
I apologize.
I like being funny is what gets the most views and stuff like that, but I do like talking about some of these other important issues.
I do need to go. So can I move this?
No, the road's closed.
But that's what I'm saying.
You know, she just thinks the world revolves around her. Like, okay, ma'am, yeah, let's just clean up. Hey, guys, pack your shit. Time to go. This bitch needs to go to work.
And all these residents, there's only one way out.
I understand, but it was advertised.
Yeah, so they told me to move my car in here.
Right, but the road is closed and we can't let people out, okay?
Okay, so like I said, I apologize, but I'm not going to do this.
No, you can't.
And I wanted to say, I don't know what kind of car she is. It's either Nissan, but the type of woman who would do this would drive like a BMW for sure. and I kind of think that's what this car is.
Move the cones. The road's closed. 10 starving units at the Patuxent place. I apologize for the inconvenience. I'd be happy to call you a taxi.
There has to be another way. I'm not taking
Oh, she's clapping.
a taxi all the way to Virginia. I work in Virginia.
I understand. And I apologize for the inconvenience. But unfortunately,
you never noticed that they were like setting up tents and like blocking the road off and shit like that. They probably made it abundantly clear. You think it's a BMW? Yeah, I definitely think it's a BMW for sure. Yeah, it's just the BMW sociopathic entitlement, how they drive, and like they just think shit like revolves around them, stuff like that too. I had an experience not too long ago where I was doing tree work at someone's house, and I put like cones up in their driveway and stuff because I was like dropping the tree into their driveway, and I made it abundantly clear, and the idiot just like drove in anyways. He just drove right over the cones and went in. It's like, well, dude, didn't you see how there was cones there and there was like a rope going to where the tree was being pulled and shit? Like it's like abundantly clear here. And they're just like, nope, you're in my way. Bye. Get out. And like, it was just like, it's crazy. And the only thing that fuels that is just entitlement, big ego. She thinks she's more important than this entire parade.
I don't have to come back.
And I should just make an exception to her. And she probably is just running late anyways.
I just need to get out. I need to get out. Like, is there any way you can call somebody?
I can't. Unfortunately, there's several people that I've had to say that can't come out. This is just one of those.
And do you think this was a man he would be saying this? Maybe, but this is definitely a woman thing. See, in her woman brain, she's thinking like, why isn't the world revolving around me? I'm being polite. I'm being nice. Why isn't the world revolving around what I need? I clapped about it. I'm doing duck hands. I'm doing all the right things. I'm trying to ask for a supervisor. Why aren't they just change? Why isn't everything revolving around me?
Times where I can't let you out.
I'm not trying to be against nobody's law, but I gotta go.
I understand. I can't have you do that.
But I
Stop. You cannot move this. I'm telling you right now.
Oh, I gotta go to work. What do you want me to do? Like, I have to go to work.
You cannot get out. I can't help you with that. Please do not disturb this area.
I might have to.
Ma'am.
She just doesn't give a shit. Look at this. The cop is just and like at this point, just drive through the tape. It'll just go like right over the car. This is ridiculous.
I'm so sorry.
You're gonna be placed on.
Yep, BMW. Yep.
Under arrest.
Exactly. That's exactly what it was going to be.
10 of a vehicle trying to run through the roadblock. It's 2 George Lincoln 4626. Stop!
If this was a man, they would have like shot him through the windshield already.
Stop your car.
What's her brother's name? Daryl Brooks Jr. Oh, Daryl Brooks Jr. was the guy who like drove through the parade in Wisconsin and like deleted a bunch of people. We need to cover that one time on this show. I absolutely thought the court case was hilarious. Actually, let me write that down right now, and maybe we'll even go look into it, but I'd rather do a good presentation on it. Daryl Brooks Jr. Parade. Driver. Okay, here we go.
Stop!
Excuse me.
Stop!
Look at this!
And there's a lady running down the street now in a BMW. Stop!
Look at this! And the simp cop, if this was a guy, he would have done something. Look at this! No, she does just literally does not care.
We're at 6 now. Stop! Stop! Get out of the car. Get out of the car. Get out of the car.
Okay.
You're under arrest.
Okay,
Damn
it. Okay.
What an idiot. So this is part of Tylenol brain, maybe too. She just, I don't even know what to say.
I didn't even get the word. Okay. I'm done.
And you know what her job is? She's probably a nurse, but she's probably one of the exact people I talked about who will work at urgent care and does not give a shit if you're bleeding out. I almost guarantee you that is like what she is like. She's not going to work because it's like her passion or something like that. She's going to work because she has to like pay for that BMW.
I know.
And this is the downtown, so she has a downtown garden style apartment. Probably pays $2,800 a month, plus the BMW, and she makes about $80K. Cooked in debt, entitled.
All right, y'all got to record. I just.
Okay, she's also cuffed at 228. Start the countdown for Floyd's Law.
Trying to get to work. I live in these apartments, and there's no other way out. Oh, my mom!
Here.
Bro, okay, okay.
Relax. Stop. 10 to Adam 5, secure that vehicle.
Move your arm!
Stop.
Bruh. Jesus help us. There's a church there. Take her for I think that's a church right there. Take her in for exorcism because she is just. I don't even know.
Everything's on camera. Stop.
I don't care. This is uncomfortable.
Okay.
My mom is right there. Jesus, call her.
You're under arrest. Sit.
Yeah, she's not dressed to be a nurse. That's a good point.
Your hands on the wall. Sit.
Okay, you can stop touching me now. So, can I go call my mom?
Do you have any injuries?
What?
Do you have any injuries?
No.
Okay. Stop. Just sit on the wall.
I just need to go to fucking work. Like, that's
Well, you're under arrest, so stop.
Bro, where's my phone?
Wow.
Just call my mom.
Now, guys, this is who's working at your healthcare facilities is somebody like this, that they just do not care.
Oh, so you can get my girl, right?
Even if she's not, a nurse in this scenario, this is like who you're getting.
Oh, let me go.
And at least they actually care about their work a little bit showing up. But for a lot of these people, work is just the distraction for them. That's why they use it as a distraction. They use it like, I just got to go to work. They think if they go to work, it just erases everything.
Oh, let me go. I'm just trying to go to work, bro.
Stop. Relax.
Oh, here's Nug Nug. The demon's coming out right at the church door.
Just trying to go to.
She has no bra on. You see this? Look at this. Look at these titties here. She might be 304ing. Look at that. She's like turned on by this. Maybe that's something in her pockets or something. She might actually be like a 304.
Trying to go to work. All I'm trying to do is go to work.
Okay. Sleep right there. Right there, that's good. Are you going to stop and sit?
I'm trying.
Like a dog?
Sit. You may sit. You may not stand up. You may sit.
Gosh.
So you can sit.
Is there a key fob?
I don't know. And somebody is live on their phone like she's doing right now, so I just turned the phone over.
Where's the phone?
On the other seat, sir.
Okay.
So she started live streaming the shit.
I got the phone. I'm just getting her ID too.
They better not give her a slap on the wrist.
Gonna hit nobody.
You almost hit 25 people coming out of the
Almost
street.
is a hit.
All you had to do was listen to me.
This is so. See this eye right here? That's Tylenol brain. Tylenol brain is, like I said, you're not aware of your surroundings. You don't understand a situation. Shit's not computing to you. You're a dark-eyed nihilist. You don't care that you almost hit somebody. If she got away with it, she wouldn't care at all. That is the part of the Tylenol brain. Tylenol brain is something you need to tell somebody, like an entire concept of something that you should never have to tell them. Like, hey, when something's blocked off and cops and people are beating on your window to not drive down the road, you shouldn't be driving down the road. And you see all these kids and people here in the street, and it's just blocked off. We're actually, when you're around the Tylenol brain people, it makes you more retarded because you have to think on such a low thinking level and dumb it down for them. Today I sold a truck to somebody and my address is a little bit hard to find, but I was like, make sure you type in this address and confirm these other things. If not, it will send you like 20 minutes north. So I said, make sure it's near a lake, make sure this and this on your GPS before you do it. And they're like, oh, okay, sure. And they just won't do it. It's like, dude, I told you 7 times to try to make your life and my life easier. I'm not telling it to you to be a control freak or something. I'm telling it to you because, my address is difficult. It's easy one to find, but it's on GPS. It's very difficult. So, Tylenol brain, raised by a single mom, never been told no. Probably, yeah. I was just trying to bring it up as a related example because that is a little bit of a black-eyed nihilist. See in her eye right now that this isn't all computing and she can just look away and think that she can just not have consequences here. That's kind of like what Tylenol brain is. They don't think of any ramifications of anything.
And you could have left. Instead, you bumped me with your car and then drove down the street and almost hit 16, 15 people. What is wrong with you?
I'm trying to get to work.
Okay. We said you couldn't drive. You could have taken an Uber.
Notice that how she just looked up when she said that? And that's a valid excuse for anything.
To get to work.
Okay.
I'm trying to get to work. So she in her mind, that overrides that no one else is important besides that one thing.
We said you could.
You are just a minor detail in her life. You're a freaking like a road. You're a speed bump. You're a literal human speed bump.
Couldn't drive.
And get to work might mean something actually nefarious because I don't know. She ain't dressed up to go to a corporate office. She might be there hoeing some type of sugar baby type thing. That's probably what it is.
Could have taken an Uber, but no, you wanted to drive your car out in the middle of the street.
And I told you my circumstances, so.
Your circumstances don't justify your behavior.
See how that didn't compute? That did not compute or register at all.
Is it a key fob or what?
Yeah, it'd be a key fob for this push to start.
Let's turn that off. I don't see what I did wrong.
Maybe a judge can make reason with you.
Okay, all right. Can you take me out these cuffs? They're uncomfortable.
You're under arrest. You're going to jail.
Okay, stop touching me. Just get off me then. Just stop touching me.
Sit and stop trying to get off. I'm not getting off of you.
Heel, ho. Heel. You're a dog. Heel.
I'm not about to do nothing.
Based on your behavior, I don't trust the words coming out of your mouth.
Little demon.
Gosh. All right. Stop doing it. Damn.
As more officers arrive on scene, one of them brings new information about the incident possibly being premeditated.
This is a planned thing. Her male counterpart asked if she could get out. Officer Kadiri gave them an option that he would escort them. That was over an hour ago.
They even tried to help her get out with everything. Wow. She probably was so just taking her time in the bathroom or doing some self-absorbed dumb shit and messed up her opportunity to even do it.
to get them out of 7th Street. They didn't come out to do it at that time.
Yeah, they waited. They wasted someone's time. Like, well, they got to revolve around what I'm doing.
She just did all this, so.
So you guys have prior interaction?
Not with her. The male half. I don't know if it's boyfriend, husband, whatever.
Sugar daddy.
They all had came to me 2.5 hours ago.
All right, now for real, can you call my mom?
No, you're an adult. How old are you?
It's not about the age, it's about where she's at. She's right there.
What's the date of birth here?
Well, I've been calling Tylenol brain a real thing, and I was calling it the let me go back to the equation here. So I'll do a whole episode on it. I was saying how it's a redundancy factor. The T fat, let me not this. It's yes. T-brain redundancy factor. So the Tylenol brain reduces your again, this is something that I'm making up, but reduces your brain's like, you just kind of like 30% of you is just kind of a dead, dumb, numb, slow, minor sociopath. And you just don't care about anything. Like a third of your soul is dead. A third of your brain processing power is dead. You cannot be a peak performer and have Tylenol brain. They cannot happen together. Maybe I'll put it that way. So it's a redundancy factor on like 20 to 30. It affects 20 to 30% of maybe the population, but it's 20, 30% of your like ability to like be in the moment, be sharp, be thinking about like the 20, 30% that didn't work for this dumb bitch to drive through a parade and not still see how she's still not understanding anything. That understanding the concept of anything, that's Tylenol brain. My friend coined this because we were doing a job cutting some trees for this guy and he wanted me to do some other excavation work, but he kept kind of like changing stuff around, not making sense. Like I cut like a 30-foot tree and him and his wife were like, oh, are you going to like replant this tree over here? It's like, are you retarded? Like we cut the like things like that. Tylenol brain. It's like once my friend had told me that, it was the only thing that made any sense, and that's what Tylenol. Like we'll go into. I'll go into it more on another thing. We'll go into it on another thing, but I'm calling it the Tylenol redundancy factor. And that's in companies, that's in services, that's in morals, it's in a whole bunch of areas.
96.
Okay. Yeah, you're an adult.
I never said I wasn't. I'm just saying she's right there, like literally right there.
Okay. You're an adult.
Okay.
Don't pull away. Don't pull away. We don't need any more of this.
You're fine.
Just be gentle. That's all I'm asking.
Hayes is 304.
I got to go to the station, do some paperwork. So we're going to be in charge. I'll be back. They're going to call it an evening unit to transport. Hey, since you dealt with boyfriend earlier about the situation, you mind doing yeah, just give me kind of the rundown on what that was this morning.
Yeah, so basically, I guess he went up to Wagner. He asked him, could he get out?
And that was at 7th and Main?
Right. And Wagner said no. So he came up to me. Basically, was just like, hey.
That's what I imagine Dante's Inferno looks like. But I'm not saying he's like a cop.
The girl got to go to work. I'll go get out. So I was like, hey. Should have paid attention. Yeah, exactly. So I was just like, hey, I'll go talk to the officer. I was like, there's no way she's going to be able to get out. But if she comes outside right now, I can escort you up there. If the officer's
so they gave her an opportunity. They gave her an opportunity. And she probably pissed away the time. Because she thinks the world revolves around her.
He was like, perfect. So he went inside, but he never came back out. I guess essentially she came out whenever she was ready and just,
which was probably like 30 minutes later.
Was made aware.
And by the way, she didn't get dressed up nice either, or, do anything like that.
Because I spoke to the boyfriend.
And that cop, this guy probably waited there like a half hour. And she's like, hey, if they're not going to come outside in a half hour, I don't even know what we're doing here. And by the way, he's not wrong. That's probably what I would do too.
How do we know that that's her boyfriend?
We don't, other than him just saying, like, coming out and saying, my girlfriend needs to get out.
Hey, real quick, you're not injured, right?
No.
Okay, because we have fireboard here. They'll check you out.
I'm fine, thank you.
Are you diabetic or anything?
No.
Do you have any conditions that we would need to know about
need
for your safety?
Tylenol?
Okay.
She ain't gonna make work. Huh? She ain't gonna make work. No, the barrels is there with the tape across them. She pulls up. I said, "Hey, I'm sorry, the road's closed." And she's like, "No, I'm."
And that guy was a simp. So the original cop let it get way out of hand. Who this body cam guy is, he let it get way out of hand. I think if it was a guy, they maybe would have been more aggressive to him. They should have tasered her like right away, or broke the windshield, or put the he should have put stuff in front of her tires or something like that. He could have handled it in a much more efficient manner. What if she plowed out a whole bunch of people because he was simping, being nice, dealing with her bullshit? Put a 1 in the chat if you think that was really on this cop here. She probably works at a bar. Yeah. That's probably right, Red Door. Yeah. She probably works at a bar or maybe a stripper. Or 304, yeah. Well, she works as a stripper. That's also like at a bar, so it's probably like each right.
Not trying to cause an issue, but I'm getting out. And she gets out of her car, rips down the.
And if this was like a middle, this is why I want stuff like you could like Singapore style, cane this woman in the streets, cane her in the streets, have it be a parade where you come up and cane this chick as she tried to drive you over. Cane this woman in the street. That's the only way that she'll learn. And that's what exactly should happen. They should be caning her in the street. If it's a guy, they should be caning her in the street. If it was me doing this, I should be getting caned in the street for this.
Tape, I stand in front of her car. I'm like, stop. Like, you can't go. And I start calling the tag out.
Instead, they're going to like give her like an ice cream and she's probably going to get off very easy for this. She'll be charged a decent amount, but she'll probably get off very easy for this, I bet, later.
Pushes me out of the way, goes tearing down the street. I'm running after her car. Firefighters start pounding on her head, so we yoked her out of the car after that. Just people only care about themselves. We talked to the fire department. Anybody that's down there, if there's any witness information for the use of force, can we get witness information? Can you put your feet down? You're getting in this car right here.
Cold, may I have shoes before I go?
Are there shoes in that car?
No, you don't need shoes. You're a dog.
Thank you.
Do you have anything in your pockets? Hang on.
It's going to reach across you.
This suspect, 28-year-old Kai Debris Bostic, was charged with second-degree
Kai Debris Bostic? What the hell kind of name is that?
assault, 2 counts of resisting arrest, disorderly conduct, failure to obey a reasonable and lawful order, and reckless endangerment. During her first appearance in court, her attorney stated that Kai was trying to get to work, and the incident was an unfortunate reaction to police instructions. The judge pushed back and said the incident was an extremely dangerous situation and subsequently denied bond for the suspect. Kai later took a plea deal, pleading guilty to failure to obey a reasonable and lawful order, while all other charges were dismissed. She was sentenced to 13 days in jail and 2 years of probation.
Road closures don't really make officers nervous, but the people who emotionally break down because of them do. Festival details teach officers something real quick. It only takes one person deciding the rules suddenly don't apply to them for hundreds of people to become vulnerable at once. That's why scenes like this get taken seriously.
But that cop simped. That cop should have tasered the shit out of her as soon as she put that car into gear.
Immediately.
What else was she going to do?
Back in 2021, 6 people were killed and more than 60.
Yeah, that's what I was talking about. Where did she learn how to drive? Darrell Brooks Jr.? This is what I was talking about. This is what I wanted to cover again. I really followed this court case at the time, and we're going to do a whole show on that.
Injured after a driver forced their way into a Christmas parade crowd in Waukesha, Wisconsin. Now that incident changed
Waukesha, Wisconsin.
How law enforcement looks at vehicles entering pedestrian areas. And honestly, the line between frustration and tragedy gets real thin once a vehicle enters a crowd.
Yeah.
Hello. Good.
Oh God, look at this. This lady's gonna be a cooked, crystal having, smoking crystal or smoking weed, stoner cat. Look at this.
Good afternoon. Hi, I'm Officer Stanley, Cocoa Beach Police Department. Hi. Hey, the reason for the stop is I had reasonable suspicion your passenger might not be seat belted in. So that was the reason for the stop, okay?
Okay.
Do you have a driver's license for me?
I do. It's in the back seat in my
Turn your rap music down when you're getting pulled over, guys.
Okay, no, you can just stay here. Are you the registered owner of the vehicle?
I am not.
What's he reaching for?
Nothing.
Okay, I wanted to make sure.
He seems like a crackhead.
Okay.
He's the registered owner of the vehicle. He has not slept in probably at least 24 hours.
Okay, I understand that, ma'am. You just have to understand.
He's on crack.
Can't see through your tinted windows, okay?
Yeah.
And so when he reached aggressively,
Look,
like
she put what is this shit up here? And it's actually this guy's car. They were saying
that, I was concerned for your safety and mine, okay?
Yes.
You say he's not slept. Is that why he was unseat belted?
He's wearing a seatbelt, just not a shirt.
Okay, but he was hanging out the window with no shoulder restraint on. So he probably put the seatbelt on when we pulled up.
I think he had it on. He probably, I don't know, he might have been underneath.
Yeah.
I was just trying to pay attention.
I understand. You're trying to be safe, and
this lady just wants some dick from this crackhead.
And I get that. I understand that. Okay. Is he 18 years old?
He is over 18.
Over 18. I just have to ask because the statute depends who the ticket goes to. You understand what I mean? Okay. So, if that was the route we go, I'm not saying that's the way I'm going. Okay.
This woman's loving it. This guy is an idiot on drugs.
Okay.
He might do some sovereign citizen bullshit. He kind of looks like the type, but more of a crackhead. He's married. I think that's a ring on his finger there.
But Mr. You're the registered owner, okay?
He's the registered
owner. He is. Okay, that's what I was trying to get at. All right, sit tight. Let me just check this out, okay? And I'll be right back with you. Stay in the car! Stay in the car! Stay in the car!
I will. He's flipping him off.
I won't ask you twice.
I'm in the car. Again, this must be in either Florida or out west thing. I'm telling you, out west, they do cocky shit like this all the time to cops. I don't understand it. I'm in the car. Paying for a ticket for no seatbelt is probably not much money. So just take the ticket and move on. What are you talking about?
42, keep an eye on the passenger. Possible signal 20.
10-4. He's the one we're looking
See, here's the thing though, like cops always like blocking all this shit off.
for this morning.
I'm in the car.
Hey, sir, how you doing?
He just tried to get out of the car and I commanded him to stay. That's all.
This actually, first cop on the body cam is actually being pretty cool. I gotta be honest.
Melissa, right?
Yeah.
I can't. Hang on one second. What was that? I'm sorry.
It's okay. I was just volunteering at Matthew's Cocoa.
I was on the phone with you earlier.
Oh, okay.
Yeah, I'm the one who called to make sure that you were okay.
Yeah, I'm driving because he hasn't slept in a while.
Like 24 hours.
At least.
And I do not need to be.
Okay. So, Melissa,
If I want to be, I can.
I'm going to have you step out of the vehicle because I need to speak with you, okay?
Okay.
I can get in the front seat.
I was just volunteering.
You can stay where you are, sir.
In the front seat, in my own car, in my own church. This is actually a church.
This guy is David Koresh crazy.
No. This is a church.
27, you're going to want to
Just so you know, this is a church.
Okay.
This car is a church.
Okay, but I need to speak with her.
Nonprofit church.
And I need you to stay in the car, okay?
So maybe I was right. Maybe this is some like sovereign citizen bullshit that he's going to do. This is actually a church, and I am just traveling through, or he's going to try to do some Fourth Amendment stuff. They live in that car, maybe car graffiti. Yeah, no, it's like some type of car graffiti, or just they're just trying to like put like Black Lives Matter and shit like that.
Thank you, sir.
Driver's seat, okay?
Go ahead. Melissa, can you come over here? He just jumped in the driver's seat.
Okay.
It's all right.
All right, Melissa, seriously, are you okay?
I am okay. He is
She likes it. She wants to get piped down by him.
having probably another manic episode.
Step out of the vehicle for me, please, sir. Turn the vehicle off before you do so.
Hate equals lie. I don't really know what the fuck is that.
He's locking himself in the vehicle.
This escalates when he feels threatened or he gets upset. That's why I was just trying to get him home.
I need you to step out of the vehicle.
What's my crime?
I need you to step out of the vehicle, sir.
What's my crime?
Sir,
And this is TikTok brain now. They think they can just do shit like that. But it's just crazy.
What's my crime?
I'm off.
What's my crime?
I'm off.
What's my crime?
Again, if you have your car like this, it makes you more likely to be pulled over. They said the whole reason he was pulled over, he was hanging out the window like a dog does.
I need you to. Hey, get the window breaker.
Where you got it at?
Let me here. You want to just keep an eye so he doesn't run us over?
I'm 27. We're probably about to break the window. Sean, open the door now.
We're going to try to talk him out of the car.
He's very escalated.
I understand.
What's my crime?
Resisting.
I'm not resisting.
Yet, then open the door now.
No, I'm not.
If we have to break this window, you're going to jail.
Get out of the car now.
Sir,
I'm going to jail.
is there, sir, you are now resisting a law enforcement officer.
I've not broken a law.
Is there anything I can say that would get you to get out of this car?
Which is true. I do not think he has actually broke a law. I don't think he should have gone into the driver's seat. That was retarded. But if he was just in the passenger seat the whole time, I don't actually think he has broken a law. Well, he broke the law of having no seatbelt on and hanging out the car window, but that's not too big of a deal. So a lot of this is going to be of his own making. And he's also trying to be like, see, I'm owning the cops and making a video of it and stuff. A ton of people think they can do this because they go out, watch these First Amendment auditing people and stuff like that. Once you're in a car, a lot of that goes away.
What is my crime?
Is there anything I can say that would get you to get out of this car, sir? Will you just punch it?
Yep.
I'm going to break the window in 6 seconds. 5, 4. He won't get out. We've given him lawful multiple orders.
This is the Signal 20 guy from earlier. From down on South 2nd that we did a well-being check on her and him.
He was the passenger, the lawful stop.
That's the cop who I actually thought has been pretty fair.
For seatbelt on the passenger.
Yeah.
When she
I
got
wanted him to break the window
out to speak with this officer, he jumped in
and shatter his expectations.
The passenger, the driver's seat,
resisting.
He's already had to be told to get back in the car. I'm afraid he's either going to drive off or drive over us. That was the reason for getting him out of the car.
All right,
he is resisting that lawful order. That makes me feel a little better.
Yeah, well, the problem is he needs to get out of the car.
Out of the car.
Do you think she could talk him out, Bets, or would it be too dangerous?
Sean, open the door. Sarge, what are you doing?
Yeah, we're keeping an eye.
I don't know if you want to pop it on that side to unlock the door.
Good call. Since that way he's sitting there. See if that back door's open just for grins.
No, it's locked.
Good.
So pop it and unlock.
Like this sovereign citizen stuff, it barely works. It barely works.
That door with the master. Do not reach for anything in that car. You will get shot.
Do you think she can talk him out?
I just don't want her to get hurt.
No, he's reaching for things in the car. Pop the window, unlock it, and I'm dragging him out.
What is my crime? What's my crime? What's my crime? What's my crime?
Yeah, I'm getting it.
What's my crime? Get out now. What's my crime? Get out. What's my crime? You're gonna get tased. Get out now. Crime. What's my crime? You. You. I'm not resisting. I'm not resisting. What's my crime? What's my crime?
See, this guy thinks he's gonna get a Morgan and Morgan claim or something.
My crime? What's my crime? What's my crime? What's my crime? What's my crime?
Let go of my ankle.
What's my crime? What's my crime? What's turn over on your stomach? My crime? What's 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 my crime? Turn over. What's my crime? What's my crime?
These people love this stuff.
What's my crime? Go ahead and chase me again. Roll over on your stomach now.
Come this way, Vince. We'll go this way.
What is my crime? Hey, Melissa, tape this. Tape this. Fuck you. Fuck you.
He's holding his vape till the bitter end. Did you see that? Look at this.
Hey, Melissa, tape this. Tape this. Fuck you.
Look at it. You see the vape in his hand? I don't know if that's a wedding ring or not, but this guy is, crazy.
You.
Drugs are bad. Okay.
Why? Why are you doing this? Why are you doing this to me? Why? Why are you doing this to me? Turn over now. Go ahead and tase me again. Stop. Go ahead and tase me. Roll over on your stomach. Go ahead and roll over. Go ahead. Go ahead and tase me again, bitch. Go ahead. Yeah. Use excessive force. Excessive force. Is that on? Is that on? Get over. Is that on?
Oh, look at that. Oh my God. So notice how they treated this guy compared to the woman who drove through the crowd. This guy I do think they are being a bit excessive. He was crazy, but he was stupid once he went into the driver's seat. So that is a problem. And like Liberty said, this is a Terry stop. No Fourth Amendment after a cop asks you to exit the vehicle. Supreme Court decision 1977. Look at this, though. Right into his eye. They don't do this to women, though. They did not play games with him.
I don't care. What? Go ahead. Fuck you guys. Fuck you. What's my crime? What is my crime? Why do you think you can do this to me? Answer me.
Switch sides.
I have mace in my fucking eyes. And I still have my vape in my hand.
Put your arms behind your back.
There you go. There's one.
Anyway, I got it.
Hang on.
You got your cups?
Hang on. Hang on. Hang on. There you go. There you go. I'm not resisting. What's my crime? What's my crime? What's my crime? Where are my Miranda rights?
Sit up on your butt.
No.
Roll over on your butt.
No. What is my crime?
Come on.
What is my crime? I can't see anything.
Get in the car.
I can't see, bro.
We're going to get some water in just a second.
Yeah, right. You don't care about me.
All right, get in. Sit.
All you care about is your feelings.
Sit in the car.
Get in the car.
I can't see.
Okay, well,
sit in the car.
Sit down.
And we'll get you wiped out.
Sit down.
SUV.
Yes.
Okay, bro. What the fuck?
Oh, fuck. Oh, don't open your eyes. Oh, don't open your eyes. You!
16 Cocoa Beach, white male, 10:15.
What happened with this guy?
He wouldn't get out. We had to
At Cocoa Beach, Florida.
pop the window and drag him out, and he started kicking me. And
Yeah, he kicks him a few times.
Okay.
now it's battery on the law enforcement officer.
The ticket was going to go to him, not her, so she's free to go.
Water! Oh, fuck. Water! Oh,
Let's get. Does anybody got a bottle of water? We can get water on his face.
water!
See, those other cops did not care. The guy who's doing the original body cam actually does kind of care. I think he's actually a pretty good cop.
Water, right? We're gonna get you rinsed off here real quick, okay? But you gotta, if we open the door.
What is my crime?
Listen, we'll tell you, but if we open the door, you're gonna cooperate, right?
Yeah.
Because we gotta get you rinsed out.
Yeah, I'll cooperate. What?
Water!
Hey.
Water!
I was gonna say, do you have something to poke a hole in it?
Yeah, here, don't squeeze it or else it's gonna go everywhere.
I've juice drank all mine. So.
Water!
It's coming.
It's
all right. And just squeeze it like a spray bottle.
Lean your head out, and I'm gonna
water.
Yeah, he's a dog. You see that dog shake he did?
Little by little, all right?
He's a rat terrier.
You gotta have to look at your eyes.
No, I'll get him med cleared before we go.
Yeah, he like crushed my f***ing balls. No, he grabbed them and squeezed on them.
Oh, really?
Yeah.
Spray, okay.
Yeah.
He grabbed the other guy's dick and balls. This guy did seem like kind of a. Someone put he's a. Repeater. So are you guys using repeater for how I use the Tylenol brain? I think someone had put that in here. And I need to go back up and look at it. I thought repeater might have meant like fatiguer or something like that. Yeah, his haircut is Evil Eddie's a ginger, but this guy is like kind of has like a red mohawk type thing.
I'm good. Keep blinking.
He likes that.
It's not going to get better. You got to keep blinking.
All right, we're about to get you med cleared, and we'll get the doctors will get the rest out.
Yeah. All right.
All right, sit back in there.
No.
You got any more in there? Yeah, let me take it just in case.
Please, more water. More water, please.
I'm going to tow this car.
They don't give a shit.
She's not the registered owner, and it's got a broken window now.
You want me to take care of it?
Yeah. Do you mind? Yeah. So, ma'am, you were the driver.
Yes.
You were not in violation of the law. Your passenger was. He's an adult, so you're free to go. I need to tell you that just so you know. You're welcome to stand and talk to our bosses as long as you want. I just legally wanted you to know you are free to go.
Nice. I like this cop.
We got to take some pictures of the car.
Well, yeah.
Cop was pretty well balanced.
Tow's coming to get it.
Yeah,
because we're not going to let her drive with a broken window. It's your call, boss. I mean,
no, none of these people give a damn about him.
You want some more?
Jesus.
I'll get it. All right, ready?
And no bowel, please.
All right, let's go. We're going to the hospital, okay?
Yeah.
I'm going to go right away.
Bring him through there?
Yeah, I'm going to bring him to the back door. All right, Sean, let's go get your eyes washed out, man. Let's go, brother. Step your feet out first.
Okay.
I won't let go. Now sit there. You feel the chair? Yeah. Go ahead and sit down there, brother.
Yeah, I like this cop here.
Now lean back.
After being treated and medically cleared, officers bring the suspect back to the squad to transport him to jail.
Well, I'm going to search him a little more properly.
You want me to take off my pants?
No, I don't.
He's going to get cocky and kind of gay now. This guy is probably like some street rat, freaking like gay truck stop dude.
Want that?
Take off your pants.
That is not what I'm suggesting, brother, man. Watch your feet. Stand right here. Good. I think we're good. Watch your head. Watch your head. Watch your head.
Yes, sir. Thank you.
All right.
And when a cop pulls someone over, one of the few things you'd expect to have to deal with is someone having a manic episode. And I've confiscated drugs, guns, and arrested people that all started with a traffic violation. But when you have to take someone into custody that's having a full-blown mental health crisis, it's a different experience and has to be approached with caution. Which leads me into this video. And I have to say up front, it's easy to look at this situation and prejudge. Because I do remember interacting with people who acted this way, and it got me to thinking. This person might have had a negative experience with a cop, or they may be having a serious mental breakdown. And this looks to me that this male is having a serious manic episode. And some of the signs are mood and behavior changes, impulsivity, and judgment issues. And we did see him flip off the cop, and the woman said he hadn't slept in at least 24 hours, which is a symptom. Now, for anyone wondering why the officer asked him to step out, because he is behaving erratic and he might have pulled off in that car, and of course they don't need that. And I've had a lot happen to me, but a groin grab, never. Because you know those movies when time slows down before the event happens? Because after it happened, I probably would have been thinking, I know he didn't just do that. And maybe body armor should be made to go a little bit lower. But in all seriousness, this footage shows the truth of what cops have to deal with. And when it comes to dealing with people that are having serious mental health crises and are a danger to themselves and others, it's often the police who are on the front lines and they do have to deal with their abuse. But in the end, this wasn't just about a seatbelt. This man was unraveling right in front of the body camera. And unfortunately, he did have to be arrested, but maybe that's the first step to getting him the help that he needs.
This suspect, Sean, was charged with 2 counts of battery on a peace officer and 2 counts of resisting obstructing without violence, totaling a bond of $11,000. He is innocent unless proven guilty in a court of law.
Nice.
How many people live here?
2 adults and 3 children that I know of.
Nobody's heard or seen it from any of them, right? There's 6 people.
Oh, there's 4.
Have you guys heard
kids?
from the wife or anything like that?
She's trying to call. They try to call every day. They've been calling. Nobody answers any phones.
For 4 days?
Nobody's been to school. Nobody has been in and out of the house, come to the neighbors.
Okay. There's 2 callers, right?
I'm the only one that called today that I know of anyway. This is the sister-in-law. Her sister's his wife.
Okay.
And what's your relationship to her? I'm friends. Just friends. Okay. Yeah.
We got the second caller saying that there was a male who was naked, rocking back and forth in the garage.
That was me.
That was you?
Yes.
You observed him in the gentleman naked in the garage, rocking back and forth. How did you see him in the garage?
I jumped the fence over here, went around, and then going back in here.
Medical stage down the road. Hi, puppy. You guys know the dog? He's really nice.
Let Lieutenant come here and make a decision what he wants to do at this point. It's been Saturday, Sunday, Monday. We're on day 4.
Well, we have enough to go welfare check on him.
Is he still inside the garage?
He said he saw him in the garage.
Unless he's moved since.
Rocking back and forth.
3-2, can you have fire respond down our direction to use their ladder to get over the fence? He's off the whole family. Huh? He's off the whole family.
Yeah.
Use your ladder to get over. Ladder go to
319. If you got any more available units on my way through.
What's up, police?
It's right there.
Show me your hands.
Sir?
Hey.
Down on the floor like a dog.
What's up, police? Hey. What's going on?
See the dog dish? Look at dog bowls.
You stand up for me?
Hey, medical. You guys check this guy out?
What's your name? He's got a wound right here, it said.
What kind? You smell that?
Mm-hmm.
I can't tell if that's him.
I can't either.
Hello, sir.
Probably need to.
Sir, can you put your hands behind your back for me?
So I want to pause this. I'm going to call it a night soon, but I'm going to play. I want to play a few like inspirational messages on the way out. There's a guy, Dennis Waitley, who made a really good book called The Psychology of Winning. It's kind of like in the 80s, but this is another one of those like sort of inspirational guys from that guy, Roy Smooth. So I'm going to play a couple little bits of music on the way out because I don't want the show to run crazy long tonight.
Almost ludicrous assignment. The Russians had always been in a class by themselves, with everybody else in a distant second class. Brooks sought the counsel of other coaches who had successfully trained world-class athletes and learned everything he could about power, endurance, flexibility, nutrition, loading, recovery time, pulse rates, and peak points. And because his players were resilient enough and eager enough to learn, he was able to make strides. They were willing to dare to try. Core values. Winners believe in their dreams when that's all they have to hang on to. You are as good as the best, but not necessarily better than the rest. If you feel you have potential, you'll invest in it. If you believe you're worth the effort, you'll put in the time and energy. If you think you can, you'll learn how. If you feel you have potential, you'll invest in it. Self-esteem is a belief that you deserve to be happy. Self-trust is confidence in your ability to manage life's challenges. If you feel you have potential, you'll invest in it. Self-centered people constantly seek approval from and power over others. Value-centered individuals give of themselves freely and graciously, constantly seeking to empower others. Core values. Open and modest, they have no need for conceit, the opposite of core value. Winners believe in their dreams when that's all they have to hang on to. You are as good as the best, but not necessarily better than the rest. If you feel you have potential, you'll invest in it. If you believe you're worth the effort, you'll put in the time and energy. If you think you can, you'll learn how. Core values. You always project on the outside how you feel on the inside.
Fight for. If you want a thing bad enough to go out and fight for, to work day and night for, to give up your time, your peace, and sleep for, if all that you dream and scheme is about it, life seems useless and worthless without it. And if you gladly sweat for it and fret for it and plan for it, and lose all your terror of the opposition for it, and if you simply go after that thing that you want with all of your capacity, strength and sagacity, faith, hope, and confidence, and stern pertinacity, you have greatness in you. If neither cold poverty, famine should go, sickness or pain of body and brain can keep you away from the thing that you want. If dogged and grim you besiege and beset it, with the help of God you'll get it. You have greatness in you. You gotta be hungry. People that want to step into their greatness are hungry. You gotta be hungry. You have greatness in you. You gotta be hungry. You have greatness in you. What is your legacy? What will your statement be? Resolve every day, read it every day. I refuse to die an unlived life. I like to leave this with you that Mama used to love to hear me say. She said, boy, say that thing for me, and I dedicate this to you, to the greatness that's within you, because it's there. The people that want to step into their greatness are hungry. You gotta be hungry. If you want a thing bad enough to go out and fight for, to work day and night for, to give up your time, your peace, and sleep for, if all that you dream and scheme is about it, and life seems useless and worthless without it, and if you gladly sweat for it and fret for it and plan for it, and lose all your terror of the opposition for it, and if you simply go after that thing that you want with all of your capacity, strength and sagacity, faith, hope, and confidence, and stern pertinacity, you have greatness in you. If neither cold poverty, famine should go, sickness or pain of body and brain can keep you away from the thing that you want. If dogged and grim you besiege and beset it, with the help of God you'll get it. You have greatness in you. You gotta be hungry. You have greatness in you.
You gotta be hungry. You have greatness in you. You gotta be hungry. You have greatness in you. You gotta be hungry. You have greatness in you.